Yes, Mr. Chair, you are being recorded.
Fantastic, thank you. All right, so I'm going to go ahead and call this work session to order on community impacts during the time of COVID-19 Roundtable. Let's go ahead and start with a roll call of assembly members.
All right, Ms. Allard,
Here.
Mr. Constant, Mr. Dunbar,
Here.
Ms. Kennedy.
Here.
I think I heard a here there from Ms. Kennedy. Ms. LaFrance,
Yes. Here.
Mr. Perez-Verdia,
Mr. Perez-Verdia will not be able to make it.
Mr. Peterson,
Present.
Ms. Quinn Davidson,
Here.
Mr. Rivera,
Present.
Mr. Weddleton,
Here.
Ms. Zolotow.
Here.
All right, thank you.
Great, thank you. So just as a reminder to the members, we are going to do questions after each of the panels, and we have a lovely group here to speak with us today. So this is the final of 4 roundtables the week to continue to inform our COVID-19 response. Last week, we held our first 2 roundtables focusing on business and housing impacts. Yesterday, we heard from some of our quintessential Anchorage institutions, and I really have appreciated the different perspectives we have heard. Today's series of panels is focusing on hearing about community impacts due to COVID-19. We've likely all seen the headlines about how certain segments of our population, including elders, people of color, and indigenous peoples, have been hit harder by this pandemic than the general population. But if we are being honest, this has been the history for these populations with every pandemic and with life in general, disproportionately impacted by every ill our society faces. We have a unique opportunity to have thoughtful discussions on how we can do better and move beyond what has been the normal. I look forward to hearing from our panelists and seeing how they can inform the work we will be doing over the next few weeks and months as we develop our response to COVID-19 in light of the federal stimulus heading our way. Before I go into the agenda, and my colleagues have heard this ad nauseum, but I want to state the obvious. We could probably spend all day on this topic and hold a separate 3-hour meeting on each of the panels we are hearing today. This is certainly not meant to be the end of our exploration, but a place for us to start collectively as an assembly before we begin exploring and fashioning our own ideas. As one of the presenters of last week's meetings stated, these roundtables assist us in developing a common foundation for us to build upon. With that, I'm going to go ahead and go through the very robust agenda for today's roundtable. So we're going to be starting, after I am done, with a discussion on child care needs, gaps, and changes due to COVID-19. We have a few folks lined up to speak during this panel. We have Polly Carr, who is the executive director of Alaska Center, and Holly, along with a few other community members, penned an op-ed on child care needs during COVID-19. We have Stephanie Berglund, the CEO of Thread, Abby Hensley, the executive director of Best Beginnings, Dirk Shoemaker, the executive director of Kids Corp Inc., and Christina Eubanks, with Hellcrest Children's Center. Then after that panel, we are going to move on to discussing disproportionate impacts on segments of our population. For that, we have a great host of speakers, including Jennifer Gates, the president of the Alaska Deaf Council, Barbara Rath, the CEO of the Arc of Anchorage, Robin Bronin, the executive director of the Alaska Institute for Justice, Mara Kimmel, the First Lady of Anchorage and President of the Board of Welcoming America, Kevin Mcgee, the President of the NAACP Anchorage Branch, Lena Mariscal, the editor of Sol de Medianoche, Camilla Hussein, President of the Board of Bridge Builders, Aaron Leggett, President and Chair of the Native Village of Eklutna, and Liz Medicine Crow, the Executive Director of the First Alaskans Institute. After that, we will move on to a panel on impacts on our elders And for that, we have Rebecca Parker, the Executive Director of the Anchorage Senior Activity Center, and David Washburn, the publisher of the Senior Voice. Then we'll move on to impacts on victims of DVSA and suicide. For that, we have Chief Justin Dahl with the Anchorage Police Department, Susie Pearson, the Executive Director of Abused Women's Aid in Crisis, and Keely Olson, the Executive Director of Standing Together Against Rape. Then last, we'll end with a discussion on workforce training. For that, we have Denise Runge, the Dean of the UAA Community and Technical College, Joelle Hall, Director of Operations of the AFL-CIO, Deborah Kelly, the Statewide Director of the IBEW Apprenticeship Program, Bronson Fry, the Business Representative of the International Union of Painters and Allied Trades, and we have a written report from the Alaska Works Partnership. So a lot to get into. Let's go ahead and get started. And I just want to acknowledge and thank everyone for joining us today, and looking forward to the conversation. So we're going to start with our panel on childcare needs, gaps, and changes due to COVID-19. And we'll get started with Polly Carr to talk about the op-ed that she penned in the ADN.
All right. Thank you, Assemblymember Felix Rivera, and thank you to everybody here. I will keep my comments short. I appreciate you having this conversation. I think it's very critical, all of the areas being spoken to today. And I'm feeling pretty humbled by the list of names that I heard who are going to be speaking, not only on childcare, but on the other issues that are being brought up later. I wrote the opinion piece along with 3 other working mothers, Anna Verzone, Jasmine Smith, and Kendra Kloster. And I wrote it as a parent, not as an organization. And I wrote it because I was feeling I was frustrated at what I was seeing was what looked like a total lack of inclusion for childcare support and a total disregard for the needs of working parents in the workforce with regards to the national economic recovery and what I was also seeing at the state level. And really more just a feeling that it wasn't even a part of the conversation, which, as we wrote in the opinion piece, which I submitted for this roundtable, is really illuminating just the lack of childcare as being seen and childcare giving as being seen as an important part of our economy, yet taking care of children is critical to keep people in the workforce. So it's actually a huge part of our economy, and we wanted to make sure that that got into the conversation. I also wrote it because I was on like week 5 of working at home, and I had a day where I just got pressed to the edge and got super frustrated. And then I paused and realized or re-realized that, you know, I'm frustrated, I'm stressed, but I am a person of privilege. You know, I have a working partner who can share childcare responsibilities with me, and I had the privilege of being able to work from home on a laptop and on a phone and do my job. I wasn't a frontline worker, and I wasn't being called into work through different phases of the reopening. So noting that and thinking of all the parents who are living on the edges of security and do not have childcare support, or who might be a single parent with 4 kids working 2 shifts and having no safety net. It really motivated us to get this out there. So I feel like my goal was to shed light on what I saw as a problem, not just with economic recovery plans, but with how we actually envision childcare in our economy going forward. So I'm interested in how are we going to address this as we look at economic recovery, funding, and relief, but more importantly, how are we going to change this system in the long term and re-envision a different model? I also will just say that in my organizational hat, I run the Alaska Center Education Fund, and we house Trailside Discovery Camp. And I got to see and experience the jiu-jitsu of trying to turn a camp into 9 locations and figure out how to follow health and safety mandates, and taking some risks while wanting to meet this incredible gap and this need for childcare that stressed out and needing parents have. And so I have been able to see it from both sides of that equation, and realizing that all of the people that are trying to provide childcare and camps as a form of childcare are also in need of support. So that's my set of comments today. Really appreciate the opportunity, and going to be engaging in this conversation in the community going forward over the next few weeks. And really happy to hand it over to Stephanie or whomever else you have on the panel next. Thank you.
Great. Wonderful. Thank you so much, Polly. And I just want to note for the record, we've been joined by Mr. Constant. I'll go ahead and turn it over to Stephanie with Thread.
Good afternoon, everybody, and thank you, Assembly members, for including me in this important conversation. Again, I'm Stephanie Berglund, the CEO of Thread. And for those of you who are not familiar with Thread, we are a private nonprofit who works across the state to increase access to affordable and high quality childcare and early childhood education. And we are considered the Child Care Resource and Referral Network across the state, and provide services, direct services for families and for early educators and the early childhood education programs where they work, and communities across the state. So I have a lot to say, but I'm going to try to limit myself to 7 to 10 minutes here. So I'll start a little stopwatch, so because I want to leave time for the rest of the panel to speak, and then room for questions and answers. So I'm happy to be a resource for all of you moving forward in this important time. So I think most of you are already aware that childcare and early childhood education, as Polly said, is already an under-resourced and under-recognized sector and field. And so we know that access and affordability and quality of programs across the state has been a challenge and a huge issue, even prior to COVID, but now I think that's really been elevated and accelerated the issues in many, many ways. We know that programs, and I know we're going to hear from a few programs in a minute, are on the brink of, of an already fragile bottom line of how they can make this work in terms of operating dollars for their business, but then also ensuring, the safety of themselves and their staff, and of course the children and families that they serve. So we've been really focused on how to help them in the short term, weather this storm. I wanted to give a few statistics of just what we're hearing, and I will just start by saying that the trends that we're seeing in childcare in Alaska and in Anchorage mirror exactly the trends and issues that are happening across the country. So I don't have any, magic bullet that's happening in other places. People are having very parallel conversations to what we are experiencing here. So there's been some national surveys done, and for those who have participated from Alaska, in March there was a survey done to the early childhood education programs across the state, including childcare programs, and 29% indicated that they would not survive closing more than 2 weeks without significant public investment. And then of those that were open at the time, 67% reported that they're operating at less than 25% capacity. So many were serving fewer children, which of course results in a smaller amount of revenue, that they were bringing in. As we reopen, and thank you, Polly, for your leadership and advocacy and your comments, because as we reopen, I think what we're struggling with, and I know early childhood education programs are as well, I can't speak directly for them, but as an advocate on their behalf, we're hearing from them that they feel underappreciated, overlooked as a critical component and a lifeline in our economy and our infrastructure right now, and really expected to just be there as a fabric of our infrastructure, but then haven't been treated as the level of importance that we see them as serving. We've been calling them mortal superheroes. That they're on the front lines themselves and haven't been recognized as such. And like I said, to help them and their small businesses survive, ensure the safety of their employees, most of which who do not have health insurance because of their entry-level, low-wage jobs, and of course, then following and trying to keep up with the evolving health and safety mandates to ensure they're following all the rules and safety measures in place so that they can ensure everyone's safety is to the greatest extent possible. So the current landscape, as things have changed over the last few weeks, across the state, there are just under 500 childcare programs, and 303 are open and 190 are closed. In the municipality, 148 are open and 99 are closed. So that's a pretty representative number for the statewide. So statewide and in the municipality, about 60% of the childcare programs are now open. And we're hearing anecdotally that of those are closed, most are anticipating to reopen, but are delaying opening for multiple reasons, right? I think we've heard anecdotally they're getting a sense of if their parents, if they have enough customers, I guess, planning to return, what their plans are. They're making sure, especially in the municipality, that they have some mitigation plans in place, and making sure they have their business administration and operations, safely structured to reopen. So of those 148 that are open, just 73 are enrolling and are considering themselves to have vacancies. So maybe some others have vacancies and are operating at less capacity, but only 73 are enrolling new children now. We're hearing anecdotally families like Polly's and others, who have choice and who are continuing to work at home, maybe have more opportunity and resource to have flexibility for their children being home. I know this landing right at summertime in camps is making that also a little bit harder, especially for our school-age children. But anecdotally, we're seeing some trends in referrals. Thread also provides free childcare referrals in our community and across the state. And the trends that we're hearing now, just in the last 10 days, we're hearing more families are reporting to us that they're seeking childcare because their existing childcare is still closed and they're needing care to return to work. So that is a huge stressor for families, not only to be returning to work, but that their existing very familiar childcare and relationship is not available for them. So they're having to restart for their family, which is an added stressor. So we've also seen some interesting behavior of programs who have opened and then decided to stay temporarily closed and then try to reopen again and not. And so I think we're seeing them try to, make the best business decisions that they can. So I'm happy to talk more about that if you have specific questions. So I just want to turn to highlight some of the needs that we're seeing. Before COVID, we knew that the demand for childcare is extremely high. 1 in 6 Alaskan workers, relies on childcare. It's about 15% of our workforce. And we have yet to see how that will shift now, after COVID. And we are confident that childcare is a support for our economy and infrastructure, as Polly said. And I invite this group and others to keep and continue to elevate that message and talk about how we can support childcare as part of our critical infrastructure. We know that if one early educator can be working right now, that can support up to 8 families getting back to work. So how are we supporting those early educators who many who are furloughed or laid off right now, making more in unemployment. How do we invite them back to the workforce and feel supported in their important work? So some of the need that we've been putting together at Thread is that we are requesting statewide support to the tune of $10 million per month for as long as COVID is going on to support childcare and their needs. So we know that they have extreme needs related to, operating on lower capacity. I mentioned a minute ago that impacts their revenue stream. We know that they are needing access to PPE, cleaning supplies. They actually need additional staff to be supporting health checks and other, safety measures. And I'll let the program speak more specifically to that. But we're looking at how we can that money to even help them just weather this storm. And that's to get back to what we were, which already was a broken and fragile system. So I love the idea that Polly presented as a conversation and way to think of how do we do this differently? How do we use this as an opportunity to leverage accelerating the issues and really the solutions to help families and the important critical infrastructure of our early childhood programs. So there's lots of solutions and ways that we can support families. We can provide more scholarships and financial assistance for families, whether to stay home with their children, or to support them with subsidized care. There's more support we can be providing for programs. Juneau's municipality just passed last week $1 million to support childcare per child. So that's one way to look at how to support programs. We also advocate heavily that we need to be paying our early educators more. They have the most critical job out there, second to other teachers, as they're caring for children and helping their healthy development and social emotional development at the time where their brain is developing the most. And businesses, how do we engage businesses in this conversation to help them have stronger family-friendly practices and also incentivize them to engage in this conversation and find some creative solutions to support and invest in childcare as part of that work infrastructure and benefit for their employees. So I will stop there. I have lots more to share and add, but want to leave time for the rest of the panel and questions. So thank you.
Wonderful. Thank you so much, Stephanie. And just as a reminder, after each of the presenters from the panels, we will then go into questions. I think it just will make it easier for us to get as many questions in as possible. Next, we have Abby Hensley with Best Beginnings. Oh, Abby, you're muted.
Okay, now?
Great, I can hear you.
Okay, great. Well, thank you. Thank you for asking Best Beginnings to participate in this conversation. And I always appreciate being part of a group that with presenters who are as articulate as Polly and Stephanie. And I really like filling in a different niche here than others have. So thank you. Best Beginnings, for people who don't know, is a statewide nonprofit with a large presence here in Anchorage. And we focus on early literacy and language development by supporting families with educational materials, activities, and events, and by mailing an age-appropriate, high-quality book every month to 8,500 Anchorage children under the age of 5, and that's at no cost to their family. And this is Dolly Parton's Imagination program that you may know about. In fact, Dolly is reading some of her books on her YouTube channel on Thursday evenings until next week. The cost is $30 per year per child, and Best Beginnings raises the money to pay the monthly bill to the Dollywood Foundation. Well, I want to tell you about some of the changes that we are seeing as a result of the pandemic, just in our own organization. We had to cancel all family engagement activities, and each of those generally brings out several hundred parents and their young children who come to play, to interact with activities, to learn new things that they can do with their children, hear storybooks read, and so on. And we've also had to cancel fundraising activities. And these days, our usual philanthropic partners, like many other nonprofits, philanthropic partners, are directing their donations to support frontline COVID-19 work. And this is not likely to change anytime soon. Also, efforts to enroll children in Imagination Library here in Anchorage have virtually halted. People aren't gathering where we would ordinarily have given enrollment forms to parents to fill out. Children aren't attending childcare programs. Volunteers aren't moving through the new baby mother and baby units at the hospitals where we also enroll children so that they can begin at birth in Imagination Library. And home visits have halted. So many of our partners are unable at this point to help enroll children in Imagination Library, which means that fewer children will have the opportunity to have books in their homes and to have those benefits that we know books bring to children at the present time and into the future. And what's changed for families with young children, in addition to the things that you've heard Polly and Stephanie talk about, we know that we're hearing from, our focus is on the family, and we're hearing from families with babies, toddlers, and preschoolers that the usual free or low-cost activities and events they're used to participating in with their families are not available now due to the pandemic. You know, the LUSAC library story times, for example, are provided virtually now rather than in person. And we know that many families don't use childcare or are concerned about having their children in childcare during this pandemic, which again is as anybody's guess as to when we'll be on the other side of this. So one thing that Best Beginnings does and continues to offer is a weekly newsletter that's emailed to parents with lots of ideas about activities they can do with their children at home so that they don't have to go outside their home in order for their children to have educational and fun activities. And the materials that parents generally have at hand, the activities don't call for extra special things that they need to order or go and buy. And while the newsletters always have a focus on literacy, on reading, writing, singing, playing, and talking, each month has a different theme. And a LUSAC library staff member recommends books on that theme. The newsletter's readership has doubled since March, obviously filling a need. So families are looking for information that they can do with their children at home. And research tells us that shared book reading, parents and caregivers reading with young children, has many benefits to both the child and the parent. And the American Academy of Pediatrics has for the last several years recommended that parents begin reading to their children when they're babies. Research also tells us that children are better prepared to learn that critical skill reading once they get to school if they've had books in their home. And children who received Imagination Library books have been shown to do better in both reading and math when they get to kindergarten. The bond between parent and child is nurtured and strengthened. And that's one of the things that the American Academy of Pediatrics especially emphasizes in their recommendation to read to their children from birth. Parents who read with their young children, we also have found through research, engage in less harsh parenting practices, and their children are better behaved, according to a recent study. And this, I think, is especially important now, as we know reports of child abuse and neglect and domestic violence are increasing during the pandemic. So I'm asking the municipality of Anchorage, as you said in the information that I received as part of this invitation, to talk about what might be a possible recommendation to the municipality. So I'm asking that the municipality consider supporting a basic need for children, having their own books that are of high quality, that are age appropriate, and that are a gift to their family. And the total number of children under 5 in Anchorage is just about 21,000. And again, the cost for one child for 1 year is $30. I think this is an investment that can support all families with young children, no matter what other services are available for their children or that families want their children to engage in. And this is an investment with an eye to the future. And we know that we want all children to be proficient readers by the time they are in 3rd grade. And we know right now that's not happening in our city or in our state. So I would just like to remind you all that families need support now. They need a variety of supports, and they need support for their children that they can actually provide at home, no matter what else is happening in their lives. And I thank you for your time and look forward to further conversations. Thank you.
Great. Thank you so much, Abby. Next, we have Dirk Shoemaker with Kids Corp, Inc.
Hi, good afternoon, everybody. Thanks for the opportunity to speak with you about childcare and children and their well-being, because obviously we all know that that's...
And actually, sorry, Dirk, before you go on, Jennifer, can we go ahead and queue up this presentation, please?
Yes, I'll get that up.
Go ahead. Thank you, Jennifer. Go ahead, Dirk.
Great, thanks. Yeah, and obviously know just how important children are to the future of Anchorage and who are going to be taking care of us at some point. And I'm the director of the Kids Corps, executive director of Kids Corps, we're the Anchorage Head Start program. And Head Start is a school readiness program for children who live in poverty or who face some other significant challenge to their healthy growth and development, whether it's homelessness, whether it's being involved in the foster care system, having a disability. So we're really focused on birth to 5 group, and we have comprehensive services, which, and I'm not sure if the presentation is up, but the comprehensive services are designed to really address whatever barrier that child might be experiencing, or just to provide whatever enrichment we can so that they will be successful on the first day of kindergarten and throughout their educational experience as possible, so that they can reach their potential. For us, the bedrock of our program is a 4-hour preschool that follows a school year. Although this year we're going into June because we got a little bit late of a late start. And we do, though, have some options that look like childcare that are open full day, full year, 10 to 11 hours a day, that are really designed for working families. So the Child Care Assistance Program is a very important part of that, where we have a federal Head Start grant that provides the bedrock 4 hours, and then the Child Care Assistance Program that then provides the wraparound services that we can provide that full year, full day for working parents. We have that model for both infants and toddlers and preschool age children. Next slide, please. And so the impact of COVID on us, and one of the things for our children, being 96%, as maybe you saw in the previous slide, living in poverty, and poverty is stressful. Some of the other trauma that children experience who are in our program, we have about 25% of our children who are identified through our social emotional screening as having a need in that area, and one of the 5 social emotional areas. So really addressing that source of trauma and really helping children develop the social and emotional skills and resilience is a really important part of what we do. And so that's really been impacted by the COVID-19 experience, because we've closed all our classes, all 14 classes, all our program models have been closed since March 6th. So that social emotional activity and interactions that happen that are really face-to-face are those haven't happened. And so we have about 2/3 of our 300 children who are going to be going to kindergarten who will have missed 3 months or so of that experience that could really prepare them, not only social, emotionally, but also the cognitive and the language development and all those other things that happen through a really high quality childcare preschool experience. We have been doing virtual services. We've done virtual home visits for our home visiting program. Not the same as the intensive services we would normally provide. And we're going to continue those through June 12th, the end of our program year. And then we are planning to restart our full year program on June 16th. And probably the biggest factor for us was continuity. And that's the thing we've been looking at. Were we going to reopen a program and then have to close again because someone was exposed to COVID-19 and had to go into quarantine, and our staff had to go into quarantine, and all the children had to be on restrictions. So we wanted to really study what we would need to do to make this work. And obviously there's no guarantees. We do the best we can to mitigate the risk. And if we can reach that level where the risk is acceptable, we can bring kids back. And so we're planning to do that. Really important to these families as they're getting called back to work, who are low income working families, that they have a place for their kids to go so they can get back to work. And it's a really important part of our mission. So we're going to take that step with the preschoolers on June 16th, and then the infants and toddlers on July 6th. We just have a move happening with the infant toddler classroom. That's why that's taking a little bit longer. And then 2 other classrooms that are not full-time, they're 4 hours a day, that we were planning to do in the summer. We're still studying whether we might do that. And we might do something different where at least we can bring kids in, say, from the middle of July up to kindergarten, and really focus on kids going to kindergarten, just so they can have some social interactions and just get sort of in the flow before they go to kindergarten. So we're still studying whether that's possible, and I'll get to what some of the challenges are and some of the things that are causing us to pause about following through as we were planning to do and having them this summer. We're not sure if those 2 classes are coming back, but we're committed to the 2 full day classrooms. Next slide, please. The really critical for us with the virtual services and the closing down was staying in touch with families, because we know what the stressors are, primarily just simply paying the bills. So we've been talking with families throughout. We've had our family advocates who've had great relationships that they've built through the year, who've been in contact with families. They've had a script that they've used to talk to families, and we're really focused on what was happening financially for them first, but also some other issues. One of the things we wanted to know about grandparents and maybe older adults, because a lot of our families are multi-generational. And, we found out 10% of the households, which was about what we expected, have grandparents. And this is not necessarily caring for children who are going to work. They're part of it every day. So they're part of that household. We wanted to think about coming back and just kind of health literacy and those things. So we just asked about thermometers. We found out that 15% of their households don't have a thermometer to take a child's temperature, to take a family member's temperature. But the big one was almost half the families, almost half the households total were impacted by a layoff or reduced hours, and they're already living check to check. So that's why we also really were focused on, did you get your stimulus payment? Did you apply for your unemployment if you're eligible for it? How's that going? And staying in touch with those supports were so important for the people we work with. And then the last slide. And then finally, just the challenges, and these are more the operational challenges. And Stephanie talked about the funding that can kind of come, that we also get through the Child Care Assistance Program. That's very important for us for those wraparound services. But it's really, for us, it's thinking about meeting children's needs, because that social emotional dimension is so important for the children we serve, and so many who have experienced trauma, that we don't want our whole day and their whole day to be one where we're constantly after them about physical distancing and keeping their cloth face covering on, which we are planning to try. We're going to go slow. We're going to be small. We're going to be static as far as our groups. So that means we need more space and we need more staff. We're going to have much smaller staff child ratios. And we're going to do that for the summer, and we'll see what the fall brings. And really our focus is on the needs of the families when this is obviously such a stressful time, and especially with families being called back to work, we know that's not going to change overnight. Their hours may continue to be reduced. There may be more layoffs. So making sure those financial supports for them are in place are going to be critically important for the children as well. And again, just maintaining continuity. We don't want to open. Kids need to know what to expect from day to day from us. And we need to be there for them, so we don't want to open and then have to close a few weeks later. So we're going to do everything we can to control for that. And just as far as resources, it's been a godsend to be a federal Head Start program and to have the resources that and flexibility that the Office of Head Start has provided. That's allowed us to provide support for families who've fallen through the cracks, who maybe needed gas in their car for an emergency, who needed food right now. And we were able to do that, and that's not normally something we'd be able to do. And then just the CARES Act to provide the financial wherewithal to keep our staff employed and so on. It's been really, really important for us. But just there's been so many groups in the community, many who are on this call, has really been just to be able to refer families to them to get support. All the ones that are listed there, that they've all been part of making sure families are supported during this time. And of course, the support and guidance from public health at all levels has really given us the information we need to feel like, okay, we can do this. So thanks for the opportunity again to speak with you today.
Great. Thank you for sharing that information. Very helpful. And just as an FYI to the members and also to the public who might be on the phone and are not able to see the slides are available. I think we have 3 different documents that we're going to be sharing during today's roundtable. So if you go to muni.org, the assembly page, and then to the work sessions page, you can find those documents. So the last speaker that we have lined up this panel is Christina Eubanks with the Hellcrest Children's Center.
Hi, everybody. I'm really honored to be invited to talk about this, and I thank Abby and Stephanie and Dirk for being able to highlight some of the needs that we have in our industry and for families that we're serving. And I appreciate everybody, all the effort and support you guys are putting in for families and community. What I would like to share is that it is often difficult for early education providers to know how to best advocate for themselves, as we often are struggling to financially survive in the best of times. And so through this, it really has put majority of providers who questioning if they're going to be able to continue, even those who are staying open. As I've watched how Alaska and how other states have responded to COVID, the phrase essential, not expendable for frontline workers keeps coming up, especially in early educator groups, because of the feeling that we are an afterthought, and we've been perceived as an afterthought yet we are essential and that we're needing to stay open to provide for cares for family, but we're not giving much guidance and up until recently just minimal supports, and that is not looking to be long-term. And so when I look at the socioeconomic breakdown of COVID in New York and the new research coming out from San Francisco, I am really concerned and want to make sure that in the next 3 months, those who are the decision makers work to ensure of our workforce who's not allowed to stand. With the same focus and are dealing with the stress.
Sorry, Christina, we lost you, your audio there a little bit. So if you could repeat that last like 10, 15 seconds, please.
Okay, no problem. So I just want to make sure that we are looking, when we're looking at the plans and how to support our workforce, we give the same effort to these frontline workers who are not allowed to hunker, we're not able to hunker down, that we need to be out in the community to providing care, getting supplies for our programs, with the same effort and focus that's been given to the stress for the families who are having to work from home and care and educate their children. Because I just don't see that that's being covered. And from the cities that are having community spread, that is where the community spread is happening. And so that is because we're going to continue to lose providers if they're not feeling that they're going to be safe. And so the early education workforce is one of the lowest paid in the state, often does not have health insurance, paid time off, or life insurance policy. And that's coming up for people because they're concerned if they contact COVID and they pass away, they're the main breadwinners for their family, and they're going to leave their families in it. And so I'm losing good staff because of those concerns. While the majority of providers in the field are entry-level workers, there are numerous providers with higher education. Hellcrest, we have 3 employees with bachelor's degrees or higher who, again, do not have life insurance or health insurance, but work in this field as a nonprofit because of their commitment to provide quality care for Anchorage's families. And early education program struggles in the best of times to maintain a consistent workforce, and the recommendations coming out from the CDC and states saying that we need to plan for increased absenteeism for staff, which is true, and that we should build a substitute or on-call workforce. We can't do that in the best of times for a slightly above minimum wage job, and definitely will not be that's just not a realistic at this point in time with the funding that we have, a realistic expectation and or feasible, as well as quality is based with consistency. And so when you're having where everybody in the community is already feeling increased stress, having people in and out to care for children is detrimental, even more detrimental. And so we really need to be working on ensuring the safety of our workforce. Another thing is we're looking into, with the assumption that we will have increased community spread as the state opens up and we move into fall. The mandate about not having any employee or child displaying any cold symptom, which again, I spent a lot of time with our families explaining, I'm not against, I think this is a very good thing to happen, but in reality, the average child in Alaska gets 10 colds a winter. Our new staff experience 3 in their first year here. And if they're not allowed to if we do not have a rapid turnaround test for COVID to sit there and say that it is a cold, and those things, that can be weeks or longer. That families will not be able to have care for their children, not be able to send their kids to school, or we won't have staff who are able to come in. And so just the logistics as we go and look out, we just need to be able to prepare for the logistics to, decrease disruption for families, and which that will then further decrease or increase the disruption for providers, because families are having a hard time paying for care that they're not able to use. And so I just want to make sure that Anchorage's response ensures that all low-paid essential workers provided the support we need to, so we do not experience the same socioeconomic in COVID cases. And we make plans because we do not make plans taken into it, consider the daily realities of our workforce. And so when we asked families, it was just simple things as us coming up and writing our COVID plan and recommending to families, staff here, when they come home, they go to like their entryway or their garage and they change out of their clothing. Well, there's making an assumption that they live in a home that has an entryway or garage versus a number of us who live in apartment buildings that have shared entryways shared hallways before you get to your apartment. And so I think it's these things that are written that don't take into consideration lower income families and specific needs that we've seen families during the hunker down time is the ability for caregiving. So families are working, they're also caregiving for their children. And so ideas that we have explored out of the box, things we're having teams of staff go into the neighborhoods to provide activities like take the kids on a walk, maintaining social distance or school rides, so that gives the families a break, either to get some work done or just a break for them, to do mental health. We've seen this done with some of the occupational therapist practitioners now. We're doing this with their clients, and this may be an avenue for families to better be able to manage. And additionally, something that I think that a lot of Alaska Anchorage is considering is having some mental health family responders.
Hi, Christina.
Yeah, am I going to that?
Sorry to interrupt. Your internet connection is lagging a little bit, so if you can maybe speak a little slower and a little louder, I think that might help.
Sorry, I turned the camera off because I thought that maybe that will help. So okay, we'll do the so having mental health family responders like some of the counties do in Oregon that provided families in the midst of a high stress interaction. So things have gone little stress. Having a team that comes in just to help mitigate, it has shown to lower child abuse and intakes into mental health admissions such as North Star, because families get that support in the moment to like calm down. They have another adult, and then they work, okay, do you have those connections? What supports they need? And I think, and it's been shown in those counties that do that to decrease their the cost for mental health hospitalization. And both of those suggestions are definitely required for families with children who have special needs. These are families who fall into that category are really struggling with having to provide 24/7 care for their children during the hunker down. And if that is to seem to continue on, or if we end up going back into those situations, it's been really difficult. So those were my thoughts.
Great, thank you so much, Christina, and apologies for the connection issue there. So before we move on to questions, a couple things. So I'm going to read a couple of comments into the record. And then we have a last minute RSVP from some members of the school district. So I am going to turn it over to them for a brief presentation, comments before we turn it over to questions. I really do want to make sure we save a good chunk of time for questions on this topic. So I'm going to read a couple of comments. So first from Assemblymember Mcgee. Sorry, I had to leave for another meeting. There will be a 2-phase follow-up on the child care conversation. Phase 1 will be on June 5th from 11:30 a.m. to 1 p.m. Phase 1 will focus on hearing from parents and caregivers to relay their concerns and experiences. We invite policymakers, task force members, government officials, and others to listen to this conversation. For phase 2, the date is still to be determined, but will be set soon. During phase 2, we will discuss specific policy responses and ideas. And unfortunately, unless you're in the chat, you don't see the Facebook event, but there is a Facebook event if folks want to look at that and find that on Facebook. Likely you can go to Assemblymember Mcgee's Facebook and see that there. Then I'm going to read a comment by Polly Carr, who presented earlier. Thank you to our assembly and for Assemblymember Rivera for this opportunity. It is wonderful to hear the other speakers' information. I have to leave. And then with that, I'm going to turn it over again for some brief comments from our school district group. So we have Dr. Dina Bishop, and then several school board members, including Margot Bellamy, Star Marcet, and Elisa Vakalis, as well as a parent, Dr. Heisel Badalich, who can speak from that perspective as well. So I don't know if the ASD contingent, if you are on the phone, but if you are, press *6 to unmute yourself. And I guess I'll start with Dr. Bishop, and then I'll turn it over to the school board members and then to the parent.
Hi, thank you. This is Dina Bishop from the Anchorage School District, and online with me are several board members as well as a couple of parents at the request of Assemblymember Felix Rivera. We were asked to share any insights with this group. Certainly, the information that's been presented so far is significant in that we work with young people as well and are partners with the many child care facilities, Head Start, after school, before school programs. I wanted to share that the same information that was presented in regard to our city already being behind as compared to other cities our same size. We found that out as well when we had an outside study in regard to school start times. One of the roadblocks was childcare, and the evidence demonstrated that cities similar to our size have many more opportunities for students and parents to engage in before and after school. We did prepare some information in regard to all the topics that you have in regard to protecting workers and workforce training and assistance to vulnerable populations. I'd like to just share in brief the work that ASB has done in conjunction with the city in feeding families, students throughout the emergency that we've had until school closing. We continue to serve about 8,000 to 9,000 meals through the summer, but we were upwards of 14,000 during this time. From nurses to transportation to mental health and additional supports we've provided. Also the disproportionality for families, very similar families that child care and other things come into my needing assistance. It was also on the connectivity and seeing being connected as really a vital, really truly vital to be able to continue to be educated. We did have opportunity for paper and pencil packets, but certainly in the realm of equity, it was very difficult when we don't have that equity in services and supports for our underserved populations to be able to participate at the same level. In addition, the difficulty with other populations such as special education is quite difficult. We service them along with our other students, students without disabilities in our programs, but as you can tell, it's much more difficult when hand over hand or hand under hand needs to take place in regard to learning. With that, I would like to turn it over to a parent who also is a medical professional who has experience on both the medical as well as school learning sides with children, and so please take over.
Hello, this is Dr. Jane Heisel. Do you want to speak to the board members first? Or I'm the parent who's on a couple of committees with the school district and also an emergency physician at Alaska Native Medical Center and the parent of a special needs child. Should I proceed?
Please, Dr.
Go ahead.
We're going to turn it over to you, and we're going to defer to you. Thank you.
And well, thank you. And primarily what I am hearing as an area of concern, both with accessing school, and it also speaks to the child care question, especially with families that have children experiencing special needs. Almost as a rule, they what I'm hearing is that the children are regressing quite a bit even in the time now that they've been out of school, and they are often, their needs either medically or behaviorally exceed what a typical child care setting can handle. And there are even children right now who need residential, even out of state, but because of the COVID mandates and quarantines, they're not able to go. And so these families are being very disproportionately affected and in crisis mode. And the medically fragile children, starting up in the fall, they have concerns about how young children, children with disabilities are going to be able to follow the CDC rules for social distancing, and how are the teachers going to be able to stay safe as well? I also worry that the perhaps Native population, having been impacted by pandemics in the past to a grievous extent, are going to voluntarily stay out of school settings even when it is offered. And so these areas, these children are the ones that I do have the most concerns about and that I'm hearing the most about. And the prior speaker did mention that the families with children with disabilities are being heavily affected, but I just want to underscore that, and they're already feeling the impact and are concerned for the future. So anything that the Assembly can do, and with regard to the funding going to that, we're open to creative solutions. So thank you.
Thank you. Dr. Bishop, did we have another parent to speak?
I believe we do have another parent online. Yeah. Please introduce yourself.
Go ahead, welcome, if you could introduce yourself.
Hi, my name is Megan Sherman. I work for the South Central Foundation. I have 3 children in the district. I work as an advocate with families of children who are suspected to have experienced abuse. So I work with families kind of all over these systems that have been talked about so far. I just wanted to talk a little bit about what I've heard with talking with families in particular. I wanted to share some of the stories I've heard. I know one mom in particular, a single mom, ended up losing her job after not being able to afford childcare outside of her typical childcare because it closed down. She eventually has moved back in with her family and has had to be completely financially dependent on them. I know of some other families that definitely are feeling the struggle of not having access to childcare and then unable to go back to work. And I just was on here to add anything to the conversation that I can.
Great, thank you so much to both of the parents for sharing. So at this point, what we'll do is we'll go through the queue, and if there's time before the end of the panel at 1:45, then I will see if any of the school board members want to add any comments. So with that, I'll turn it over to Mr. Dunbar.
Mr. Dunbar, this is Christopher. I just am asking for the ability to briefly step in front of you so I can get to the AMATS meeting that starts right now.
Sure.
Forrest, thank you, Mr. Chair. And this is a question for Dr. Bishop, and I don't need an answer right now, but hopefully a prepared answer for our next meeting. I'm assuming you're tracking extraordinary expenses related to COVID, and we've been getting kind of biweekly reports from the administration over here about the nature of those expenses. Could you please prepare for us some kind of brief on the nature of extraordinary expenses and holes in your budget that you're seeing relative to COVID? And then maybe even a call-in for anticipated sources of funding so that we can start to see a big picture of the actual needs that you already have had to sink into the operation. And with that, I have to leave. Thank you.
Thank you.
Thank you for that question. Would you like me to proceed?
Go ahead, Dr. Bishop.
Okay, thank you. So we are collecting those. Thus far, we have 2 million has been expended simply in just the preparation of supplies and different items through the end of the school year. Now we are really working towards that mitigation of that learning loss that was spoken to by our parents. And the effect of not having school and then trying to reinvest, especially into student populations that might be more vulnerable than others, we are finding that through the summer, the expenditures are increasing. We did scale our summer school to try to do additional reaching out, understanding that next year we are preparing for a low risk, medium risk, and high risk. Those would include what Head Start had also shared, students with masks. Our board at the Finance Committee meeting heard the first sharing of an additional $6 million to ensure that all students in ASD will have access through Chromebooks, some type of device, whether it's their own or one provided, but also $1 million of that is for connectivity to ensure that our families have access. Those are just, the hardware and other types of things, but in regard to the preparation and support that families will need through mental health, counseling supports, our work with United Way and Volunteers of America and some other partners is increasing the supports to families. It was mentioned before that the impact in learning is going to be significant, and it's going to be more significant for students who have had less access or who may have learning disabilities. So we will know more as the impact as this goes on throughout this year. However, I can prepare that assessment for you, but in regard to these things are primarily around the supports of students needing to succeed in an equitable fashion.
Wonderful. Thank you so much, Dr. Bishop. I'm looking forward to hearing more at our next joint Assembly School Board meeting on June 12th, I believe. With that, I'll go ahead and turn it over to Mr. Dunbar.
Thank you. So my question is for Ms. Berglund or anyone else on the child care portion. I know you floated a few ideas, but I was hoping we get a little more specificity on, assuming that the municipality of Anchorage receives, let's say, $156 million in CARES Act funding. And let's say that we dedicate, let's throw out a number, 30 million of that to childcare in some capacity. How, in your opinion, what would be the most effective way to spend that? Would it be voucher programs? Would it be some kind of direct support? Would it be something else? I'd really like some specifics as we start to think about crafting our policy response. Thank you.
Thank you for the question, Mr. Dunbar. We right now are advocating for resources to go directly to the small businesses of childcare and early childhood education programs, and recognizing that we need them to be there for businesses as they reopen and for families as they return to work. So that is our top priority, and to maximize support for them. You heard some specific challenges from Dirk and Christina that programs are facing. So, ensuring that if they're a licensed and regulated program in the municipality, for them to be automatically eligible, to find a vehicle to get them money in the fastest and easiest way possible. With the fewest strings attached, they're already, following licensing regulations and other oversight rules and accountability, and are ready to, thoughtfully and intentionally support what's needed most. So we know, and you've heard, that there are varying needs. Specifically, there ways to support children returning and in their care. We know that they are needing to support families. We're hearing pretty compelling stories, even how programs are supporting families pay their bills, and supporting them as part of our network of our community. But we also recognize that the early childhood workforce is really critical. And with the changes that have happened at the university over the last year and a half, we're concerned about the workforce supports and the workforce pipeline. You know, we need to make sure that they continue to have a place to work in our communities and are well supported with a livable wage, benefits that are needed to keep themselves and their families safe and viable. So we know that the best way we can support them right now is through their employer of the child care program. So our request right now is to start with the programs and following that, you know, ways we could directly support families through scholarships and other ways of supporting access to quality care. And then, like I said earlier, you know, possible incentives to businesses. And that could even just be through you know, some assistance in how to be a more family-friendly employer.
Could I ask a quick follow-up, Mr. Chair?
Go ahead.
So I understand the desire to put the money through the employers, essentially through the providers.
Mm-hmm.
How do we? And I also understand we want to make that with as few strings as possible to maximize flexibility, as you describe.
Mm-hmm.
But how do we basically, how do we ensure that it's still affordable for people in Anchorage? You know, how do we know that there aren't some providers, and not casting aspersions on anyone, but some providers that would take that money and then maintain very high rates and basically get windfall profits, because there's so much demand for this and so many families feel stuck because maybe there aren't enough that are taking new families. So how do we make sure that childcare is affordable for the widest swath of Anchorage's populace?
That's a tough question, and maybe Christina or Dirk can chime in on this. I mean, already childcare I would deem is unaffordable for any family who's accessing it, right? So if we could solve that together, we would be in a different place, I think. You know, the average cost of childcare across the state's over $1,000 a month for families. So I would consider that not affordable, you know, and families collectively are spending more than 13% of their household income, you know, on their childcare expenses. That is not affordable and sustainable for most families. So, you know, you could put restrictions on it to say, you know, that, you know, you have a desire or a request for some of these resources to be offsetting tuition or supporting families as they return. You know, we're just right now looking at the bare minimum of the infrastructure being available to families, right? So if the priority is instead to support families with resources, there may not be childcare program for them to use that resource, that scholarship or voucher, you know. So we at Thread are prioritizing, you know, support for programs to ensure that infrastructure is there when families and businesses need it. And second, you know, prioritizing other options. So I don't know, Christina or Dirk, if you have other things to add there.
This is Dirk. I really don't. It's a good question, but just what you said, Stephanie, there's already so many needs in the field that they're undercharging really as it is.
Thank you. And then I'm going to go ahead and read the comment from Christina. So the cost of providing care is increasing due to COVID, so funding is needed to ensure that we stay open.
Yeah, so I would argue on behalf of the programs, in order to stay solvent, they may need to continue their tuition rates in addition to public investments to help them survive. So I would advocate again for that to be as unrestricted as possible so that they can use that in whatever is needed. You know, they're increasing their costs for staff, they're increasing their costs to ensure health and safety of children and families and their staff. They may need to pay their staff a little bit more right now. So we know that their costs, like Christina said, are increasing, and that may not change the other income and revenue that's needed to support their families that they're serving.
Great, thank you. So I'm going to read one more comment from Christina, then I'm going to turn it over to Ms. Quinn Davidson for a question or comment. And then unfortunately, we do have to wrap this this wonderful panel up and move on to our next one. So one more comment from Christina. So the workforce already subsidizes the cost of care with the low wages they earn. Thank you for that comment. Turn it over to Ms. Quinn Davidson.
Thank you, Mr. Chair, and thanks to all the speakers. I was pretty much going to say the exact same thing as Mr. Dunbar. Before I got elected, I kind of thought that elected leaders would just know how to fix problems, and we would just tell them what the issues were, and then they would create the programs that made sense. And now that I'm elected, I realize that that's not the case, and we actually rely on you all heavily to understand, and so does the administration, to understand your field. And so I would just urge you, as similar with what Forrest asked, we need to know exactly what you want and what you think is best and how the programs work. We're going to be creating it, but we're also looking at small business things. We're looking at nonprofits. We're looking at things that are completely out of the childcare field. So while I think many of us really care about this and this is a top priority, we actually need hard details on what you'd recommend. So I just urge you, even if it's in a follow-up, to please share those with us.
Can I just ask what the best way is to forward that or pass that along? I don't know if there can be just a follow-up email of how we can provide that specific information for you. Thank you. We can do that.
Great, thanks. We'll put the email in the chat, but you can likely just email all assembly members at wwmas@muni.org. And we'll put that in the chat just in case you didn't get that. Thanks to everyone for this wonderful conversation. Like I said at the beginning, we could easily have talked about this for hours, but unfortunately we have a limited time today to go over a lot of important topics. So our next panel is going to discuss disproportionate impacts on segments of our population. So looking forward to hearing the insights from these panelists. Roughly, just to put a time element on this, if panelists can please limit their questions to about comments to about 5 or 6 minutes. That way we can leave enough time at the end for questions from members. So I'll go ahead and start with Jennifer Gates, the president of the Alaska Deaf Council. And if any of the panelists are on the phone, to unmute yourself, you need to press *6. Jennifer, are you with us? Okay, I'll go ahead and come back to her after we hear from everyone else. So next, I'll turn it over to Barbara Rath, the CEO of the Arc of Anchorage. And Barbara, you're on mute.
Sorry about that. Hi, everyone. Thank you again for the opportunity to speak and share. And it's just wonderful to see our community come together during such a challenging time. I'm not sure if everybody knows much about the ARC, but very quickly, the Arc of Anchorage is a nonprofit organization that supports individuals who experience an intellectual or developmental disability and or behavioral health challenge. We approximately serve 300 plus individuals and their families, and we have approximately 290 staff. And of those 290 staff, what's really important to keep in mind is that approximately 70 of those positions are what we would consider in an administrative role or a program support role. The rest of the 130 are all made up of our frontline staff, and that would be our direct support professionals. We call them DSPs, or our job coaches. And that front line is extremely important to what our agency does in helping the individuals that we support. We do have a variety of services that take place prior to this pandemic in the person's home, community, school, work setting, and we have approximately 13 licensed homes. That means that they're licensed by the state of Alaska and they have oversight of governing our regulations and making sure that we adhere to health and safety standards. During this pandemic, when it immediately, I would say, our initial challenges when this all happened, as soon as we were supposed to close down, we took our main campus and closed it to the public and continue to follow all the local and statewide and CDC guidelines and mandates. So our campuses, we are still conducting services, but they are very, very limited with a lot of restriction involved. We do have, our campus is open to staff, but it's a very light rotation, meaning that we usually have less than 15 people coming through the campus daily and doing work. The rest of the work is done from home. Some of our initial challenges, if you could take a moment to think about our group homes, many of our homes are made up of individuals that have different medical conditions, different medical diagnosis, different behavioral health experiences or challenges. There are a variety of physical and mobility strengths and abilities. We also have individuals who are at different ages and stages in their lives. So it has been initially very challenging to continue to support folks through this time. All of our services pretty much came to a halt minus the 24/7 coverage that was needed in our group homes. Knowing this, initially we had to cross-train. We had to take a lot of our staff and do cross-training in our homes, which was a risk at first because we did have a lot of people going in and out of the homes. But because we have to provide those 24/7 cares, we needed to make sure the workforce was prepared to go in if we had to formally quarantine a home. Initially we had our staff cross-training, but since the initial onset of this pandemic, when we received clarification from the state of Alaska, both from the Division of Senior and Disabilities and the Division of Behavioral Health, that governs our certification to provide these services, we had more flexibility. So as of lately, we've been able to increase some of our independent one-to-one services, but we have had to continue to cover those homes 24/7. So it has been a challenge for us, not just physically and logistically, but it's also been a challenge fiscally. Many of our services had discontinued, people have disengaged, even when flexibility has been clarified and put back into place. We've seen a mass reduction in people being afraid and anxious to go out into the community with our staff. And we've also seen a mass decline in revenue. It's been a challenge also to balance between the families and the individuals who are afraid and who do not want to go out into the community versus those that are anxious to get back out into the community, or the families that want their loved ones to come home for a visit. We also had a lot of some staff who had declined to work because they themselves fall into a vulnerable category. So not only have we had a disengagement of service delivery and revenue, but we've also had a disengagement of staff available to work. Some of our concerns and challenges going into the future post this pandemic, again, much like what folks have already shared, we want to reopen responsibly. We want to be careful. We want to make sure that we adhere to the guidelines and try our best to ensure health and safety continues, reducing risk and exposure. But we are concerned that we're an agency that was fortunate enough to be able to apply for the PPP loan, and that did help us drastically be able to continue to pay for our staff to work. But that comes with a lot of limitations and a short timeline. And one of that limitation and timeline issue is that all the money has to be used on payroll by June 30th. And so one of our future challenges and concerns is that, are we going to still have a workforce to support our individuals? And if our individuals still stay disengaged, will we be able to continue to be in a strong revenue position? Now, in regards to disparities, nowhere locally have we noticed or have it's been brought to my attention that any of our individuals had unfair medical treatment during this pandemic. But I do know at a national level, there have been already civil rights cases filed where individuals with disabilities or mental health had symptoms or went to receive medical treatment because of the pandemic or COVID and were declined or mistreated. So far, I feel strongly that our state has done a great job in making sure that everyone is given fair treatment. Some of the
and actually, sorry, Barbara, we're running out of time. So
okay.
If you have one last comment you want to make, I'm happy to hear that.
Oh, no, we're good. We can move on.
Oh, okay, thank you so much. So next we have Robin Bronin, the Executive Director of the Alaska Institute for Justice.
Thank you, Felix. And so I'm not going to use my video because I have low bandwidth at my house. And so I'm hoping everybody can hear me. Yes?
Yes, we can hear you.
Okay, thank you. So thank you for this opportunity to present about disproportionate impacts to the communities that we work with. And I first want to recognize that I'm giving this presentation on the unceded lands of the Dena'ina, who have been stewards of this land for millennia. I work as the Executive Director of the Alaska Institute for Justice. We are celebrating our 15th year of existence, and our mission is to protect the human rights of all Alaskans. Today, I'm going to talk about 2 of our 3 programs. So the first program I'm going to talk about is the Language Interpreter Center, whose mission is to make sure that everyone in our community has access to the information that they need, regardless of the languages that they speak. And to accomplish that goal of language access, we have been training bilingual Alaskans now since 2007 to work as professional interpreters. We've trained bilingual Alaskans in over 40 languages. We've held training programs here in Anchorage and Bethel and Utqiagvik and in Nome. And through those trainings, we then provide work opportunities for the people that we have trained so that they can provide professional interpreter and translator services to all of the government and nonprofit agencies in our state. And so to start this presentation about language access, I want to give a giant shout out to the municipality because we have been working with a language access task force that has been led by Shannon Kuhn. And our task force includes about 10 people, mostly from within the municipality of Anchorage, but some also state government representatives. And our goal has been to make sure that everybody in our community has access to the critical health information related to COVID-19. And we just made a significant leap forward in getting everybody in our community access to this information by using what we call site translation, where on a weekly basis, the municipality is taking the information that is provided by our state and the municipality in English, making that document into plain language English. And then once a week, this document is being translated, I believe, into 12 different languages orally. So the interpreters are taking what's written and interpreting it orally, and it is being posted on the Muni website now on a weekly basis. This is a giant accomplishment that has taken a lot of effort of not only the municipality, but of the many different nonprofit agencies and state government agencies that are part of our task force. And so I would say the gap in language access is now in the nonprofit community. So what we are very concerned about is that as nonprofit and other entities are providing services in this time of crisis, to make sure that their information is being provided in languages other than English, and not using children who are usually the bilingual members of households to convey that information, because the trauma to those children, it's been well documented. And it's one of the reasons we created the Language Interpreter Center, to make sure that children would not be used in any context to interpret. The second program that I want to talk about that's housed within the Alaska Institute for Justice is the Alaska Immigration Justice Project. So we are the only nonprofit agency in Alaska that provides legal representation to immigrants and refugees residing within our state. We provide those services to about 900 Alaskans every year. Probably about 600 of them live within the municipality of Anchorage. And our priority is to make sure that our services are available to crime victims. So in regard to crimes, an enormous number of our clients are victims of domestic violence and sexual assault. We also work with human trafficking survivors, and the work that we do with human trafficking survivors is not just limited to immigrants. We are also working with United States citizens, and these are individuals, the immigrants with whom we work, these are individuals who are eligible to get their immigration documents based on federal law. And as you might imagine, all of the folks that we work with at the Alaska Immigration Justice Project are living in tremendous fear right now because of the intensity of hateful rhetoric that is being broadcast almost on a daily, if not more than daily basis by our federal government. And so people are feeling tremendous fear to reach out to anyone to seek assistance for any reason because of their fear that they could be deported and permanently separated from their family members. And as a consequence, so when the virus took hold nationally, the Immigration Service, which is the federal government agency that adjudicates these decisions, paused all of the application processes that our clients were in the middle of. And so folks normally can wait a couple of years to get their documents, and now we're not sure how long people are going to have to wait to get, for instance, work permits. So if you are undocumented in the United States, you are ineligible to work. You're not able to get a Social Security number until the Immigration Service actually gives you that permission. And so we have hundreds of clients who do not have Social Security numbers, are waiting or work authorization. They may be working, but they do not have that authorization to work. And they are now in a multi-year backlog of wondering when that documentation will happen. And so as a consequence, none of our clients, none of these folks that we work with are eligible for any of the federal stimulus money that became available. They are not available, they're not eligible for unemployment insurance. And so we are desperately concerned about how they are supporting themselves. The board of our agency set up a GoFundMe site where we're trying to raise $5,000 so we can give $500 to families who are desperately trying to figure out how they can survive in these really uncertain times where they've been living in fear now for years, and now with the economy the way that it is, they are no longer able to financially support themselves. And then finally, the last category of folks with whom we work, with whom that we are very concerned about, are the dreamers. So some of you may know about them. These are young people who came to the United States as children, and they do have work authorization, and they do have Social Security numbers if they applied for the DACA program. And so they're eligible for the federal stimulus money. However, the US Supreme Court is going to be making a decision now in the next couple of months, maybe not even that long, about whether these dreamers are going to be able to continue to stay in the United States. And at the agency where I work, we're working with between 40 and 60 dreamers, most of whom are in Anchorage. And so we're very concerned about what the consequence will be for them, because they will lose their work authorization and their Social Security numbers. So I really appreciate this opportunity to talk about the folks who we serve and who have been left out of the federal stimulus money that has been available, and are in dire need of legal representation. So there are only 2 full-time staff attorneys in my office who are paid, and then we have a volunteer full-time staff attorney representing hundreds of Alaskans. We desperately need additional funding to provide representation to all of the folks who are in need in our community. In other states, that funding has been available. It's just not been available in Alaska. Thank you.
Thank you. So next, I'm going to turn it over to Meryl Kimmel, First Lady of Anchorage and President of the Board of Welcoming America.
Hi, you can hear me and see me?
Hear you, and yes, we can see you now.
Great, terrific. Well, thank you so much, Assemblyman Rivera and other members of the Assembly, and I want to compliment you all on your foresight to hosting this series of meetings. I know these have been very, very long days, but I think that hearing from the communities that you serve about the impacts of COVID as you're making decisions and public policies that impact all of us as residents, it's a great opportunity for us to share with you and for you to start to think about how you want to formulate a response. And I just have to say too, I'm very honored to be part of an incredible group of people who have spoken before me and will speak after me today and in the other hearings that you've been holding. I think that what you've been hearing are people's commitments to making sure that our city and our state have opportunities for all of us and that we're leaving no one behind. And that is basically the mission of an organization that I'm affiliated with called Welcoming America. And as First Lady of Anchorage, I've started a couple of initiatives locally to promote this notion of belonging and inclusion in our city alongside this idea of resilience. And so what I wanted to speak with you about today is, as we're looking at how we can better address disproportionate impacts of the pandemic on our community, it's really important to be thinking about structural changes. And if we're going to make sure that all of the members of our community can rebound from the impacts of the virus, we have to focus our efforts on the ways that we rebuild. And the ways that we rebuild need to be consistent with our city's vision and our city's values. We've done a lot of work over the years to make sure that Anchorage is a welcoming and a resilient community. We are sitting on the traditional lands of the Dena'ina Athabascan, and as a result, we've all been privileged to learn and live the Indigenous values of always getting ready and of recognizing who we are and where we are. And these together are the collective values of our city, which are being incredibly tested during this very difficult time. And so as we look to how can we emerge from the impacts of the pandemic, we have an opportunity to rebuild our economy and our community in ways that enhance our self-sufficiency and reduce our vulnerability to pretty critical supply chain interruptions. We know that a resilient and a welcoming Anchorage better protects our economy and the health and well-being of our city's residents, and that we can forge a new path, not the path necessarily that we were on, but on one that promotes and protects opportunities for everybody who lives here. And so our responsibility, and particularly I'd offer your responsibility as leaders in our community, is to identify areas that most profoundly test our resilience and to act to stabilize these most precarious sectors, institutions, and systems that you're hearing about today, and also our most vulnerable and precarious residents and community members. But it's really important to remember that we have an opportunity right now to be proactive and not just reactive. And what's interesting about the pandemic is that it's revealing so many of the barriers that have kept so many of us at the margins of civic participation and economic opportunities. And so we're realizing that as we're emerging from this, we can take those barriers down. As Wayne Gretzky would say, we need to skate to where the puck will be. We can position ourselves for a future that we want, not the past that was. And so my comments today regard the opportunities to build welcoming and resilience through strengthening not only health and well-being, but also ensuring that our economy bounces back in ways that mean jobs and opportunities for all of us. We already know that we have to strengthen community health and well-being in order to protect the public. And in addition to the amazing job that our health department, our local health department has been doing, and our health partners to ensure that we stay safe, and especially as we're reopening, and we're all trepidatious about that, there are different components too that we need to be looking at as indicators of health and well-being. For example, we have to make sure, and I know that you've heard from folks on this, but we have to make sure that people have access to quality, affordable housing. We also have to make sure that people have access to food in ways that continue to promote choice and dignity, and that our city's food supply is uninterrupted by continuing to build opportunities in local agriculture. And we see examples of that in the Grow North farm, for example, up in Mountain View. And that last point about food security is really important because it's not only vital to health and well-being, but it's also an area of potential economic strength and security. We can also think about the work that we've done and be proud of the work that we've done to ensure that all residents have access to critical information that keeps us safe, no matter what languages we speak. And this is a point that Robin just raised, that with our partners, not only from the municipality, but from the Alaska Institute for Justice, the Alaska Literacy Program, the Refugee Assistance Program at CSS, and many other partners, we've made language access much more of a reality for so many of our community members. We like to brag about the fact that we speak over 100 different languages in our streets and in our schools, and it's really important that we see that as a strength, but we also know that we bridge some gaps that may exist because of that. So when we're looking at promoting health and well-being, we have to be addressing the social determinants of health, and we have to understand that to promote well-being requires a multi-sector approach. And when we give ourselves these vital building blocks, we can make sure that we're charting our way through this and any future uncertainties. We know that the wealth gap that we experience in the city creates a health gap, and the health gap then creates a wealth gap. And so we find ourselves in a moment where we can reimagine our economic future, and we can transition into new and expanded economic opportunities that honestly were urgent even prior to the pandemic. As a city and as a state, we know that we're absolutely dependent on oil revenues and tourism. And that dependence on outside forces that are very often beyond our control make us pretty vulnerable. So as we rebuild our economy, one of the goals that we need to make sure we have in our minds is how to reduce that vulnerability. How do we keep and maintain our local values of self-sufficiency and independence? One of the things I think that we need to be considering is how we look at infrastructure investments. And how do our infrastructure choices and the spending choices that you're going to be making, how do those investments account for principles of inclusion? How are we thinking about investments that understand and acknowledge the differences in incomes, race, educational levels, language skills, ages, physical and mental abilities, and other vulnerable populations? When you're making decisions about where and how to spend money, contemplating those aspects of these decisions is really vital. Also looking at the way that the decisions that we make about infrastructure investments promote health and safety for our residents and build a quality of life, and that they're sustainable and can withstand maybe not this pandemic, but other future crises that may show up on our doorstep. I know that you're hearing from workforce people later today, but I also wanted to just talk for a minute about that. We know that Alaskans are a talented and smart bunch of people. Our workforce has skills and expertise, and we know how to survive and thrive in tough environments. But what really I think could use a little bit of help is building a strong local infrastructure so that we can make sure that those skills and those talents can come to fruition and that we have a strong workforce. And so by focusing on workforce development, I think one of the areas that we need to be looking at is how we strengthen the workforce development ecosystem so that it does capture the expertise, talents, and knowledge of all Alaskans for Alaskans. We know that in that way, we'll be able to fight brain drain and to keep our kids here once they've gotten educated. We also know that we'll be able to fight brain waste and make sure that we're putting Alaskans to work for Alaskans. We also know, as you've heard earlier, that childcare is a really critical piece of workforce development and infrastructure. We know that we are a very entrepreneurial state. We as Alaskans like to start businesses and we like to hire each other. And one of the ways that we can ensure that this trait continues is to stabilize our economy by investing in it and supporting our local businesses. I'd really like to call attention to the work of the Assembly and the municipal administration for passing a few weeks ago an emergency grant fund. And today we were really excited to announce that over 120 small businesses, sole proprietorships, and nonprofits were able to get assistance from this grant fund. And what we were able to do is expand the opportunity for funding for those businesses, nonprofits, and sole proprietors to make sure that they could weather this storm. And I know that there was a lot of discussion in the Assembly about the goals of such a program. And I just wanted to read a quote from one of the program managers on this, on the success of the program. And he told us that reviewing the full list of awardees makes it abundantly clear that information about this opportunity reached business owners in minority communities and disadvantaged neighborhoods, as well as businesses whose owners don't speak English as a first language. This program was focused on assisting those who've been left behind, and it appears to have achieved that purpose. So I really wanted to acknowledge the hard and brave work that you as the Assembly have done to make sure that those funds were available. And I'd like to encourage, as you're moving through thinking about the ways that you're going to be spending the dollars that come through the state, to think about that as an option. There were many more organizations and people who applied for funding than were able to receive it. But there's a crying need out there, and you hit the mark. And alongside that, we need to continue that we're working with local CDFIs, community development financial institutions, to make sure that in addition to this grant funding, people have access to low interest loans that can again help stabilize these small businesses that are the foundation of our local economy. We also, one of the things that's come up through the Economic Resilience Task Force is the need for small businesses to have access to technology and online platforms so that if we do need to shut down again, people can deliver goods and services in as much of an online way as possible. We also know as Alaskans and as Anchorage residents that we are innovative. We can grow our economy by looking around corners for the possible areas of growth. What can we do to not to replace necessarily, but to pivot away from an economy, again, that was built really strongly on dollars from oil industry. And so when we're looking at that, we can look at opportunities to promote clean energy. We are an energy state and we're capable of producing our own clean energy. that not only will bring down costs of living for our residents, but also create job opportunities and new economic sectors in our community. And by focusing on building clean energy opportunities, you're doing the work that you've already acknowledged needs to be done when you endorsed the city's climate action plan and the resilience work that this community has been doing and the welcoming work that it's been doing. We also know that we're at the center of global transportation networks. And with our partners at the University of Alaska Anchorage, we've been doing some pretty incredible small manufacturing. But think about what could happen if we could expand this manufacturing effort into larger opportunities. We know that to truly capture our imagination and our innovation, we need to make sure that all of us have the ability to be fully engaged in the solutions that we have potentially at our fingertips. And this is why it's so important that you're having meetings like this, so that we can understand the barriers that keep people away, to know what we're missing as we chart a path forward. And so I wanted to thank you again in closing for having the foresight to do this. Thank you.
Wonderful. Thank you so much. And I really wish we had so much more time to go in depth and have more dialogue on a lot of these different topics being brought up today. But just looking at the clock and acknowledging the time that we have approximately 25, maybe a little bit more minutes left for this panel. So I'm going to go ahead and turn it over to Kevin Mcgee, the president of the NAACP Anchorage branch. And Kevin, I'm not sure if you are on the phone, but if you are, it's *6 to unmute yourself. Okay, we'll come back and see if Kevin maybe has joined us a little later. So next we have Lena Mariscal, the editor of Sol de Noche.
Hello, and thank you for the opportunity to be here. I am going to be very brief with what Sol de Medianoche, Alaska's bilingual newspaper, does and why we do it. We are 4 years old and started because we saw the need to inform, educate, and unite our Latino community. We use the newspaper as a way to communicate to our own community, but also for the community at large to communicate with us. So during this pandemic, I went around the community and asked different members to give me an idea of what the most important challenges were for the community. And I have a list that I wanted to bring up. Most of the challenges are no different than the rest of the community. However, the main one, of course, will be access in our own language to facts about what is going on in the community and also about the pandemic. So we have been trying to inform the community through Zoom meetings. We've done one on health information through volunteer doctor from Providence. We had a panel discussion with the Anchorage School District. We did a small business presentation with the Small Business Administration. And then we also had the state do a presentation on how to apply for unemployment. Because of having to do this in Spanish, it has been a little challenging to get the information to the community, but what I have found out is that we do have the resources. It's just making sure that there is a mechanism to get those resources to get to the community. So for instance, the state has 2 people in their unemployment office that speak Spanish, and having them answer questions in our own language and explain things was very, very informative and got some people to actually try and apply for unemployment. What I wanted to say is that it is very important for the community to connect in our own language and to also do it in culturally sensitive ways. The list that I have for the challenges that I wanted to bring up is, of course, unemployment. How does somebody go through the system to apply for unemployment? How do they access other work opportunities if they lose their job? How do parents do some of the homeschooling that now they're having to do, and how do they also get support with the technology, as we know that that has been a challenge for parents that are not familiar on how to get their kids to do homework and stay engaged. Childcare is also a very high priority for most of the parents that need to work, and childcare centers are not available to them. Also, if somebody loses health insurance, how do they access health insurance? And the main thing that I wanted to say is that most of our community fall into the essential workers group. So for us, it is very important to make sure that whatever information we can do we can give them to facilitate returning to work or staying safe at work is a priority for them. And I don't think I have anything else other than ask that we try to be proactive. Since we know that this pandemic is going to be here for a while. So if somebody has any information that they would like to include in the newspaper, I'll be more than happy to translate it and make sure that it gets to the community.
Great, thank you so much. Next, we have Camilla Hussein, the president of the Board of Bridge Builders.
Hello, everyone. Thank you for allowing Bridge Builders to be a part of this conversation. Thank you for the municipality, the Alaska Institute for Justice, and all the other organizations who have participated in making language access a top priority in reaching out to the communities who do not speak the language. Very quickly, I wanted to go over what Bridge Builders is. Bridge Builders is a nonprofit. It is to promote, the main purpose of Bridge Builders is to promote, celebrate the harmony, respect among all cultures. We have we celebrate the differences that make Anchorage unique, welcoming, resilient, respect the customs, cultures, the colors, the dreams, and the ancestral traditions. So to integrate that message into the fabric of Anchorage, what our duties are is we invite the community to attend events, annual events, bring food, potlucks, the MLK celebrations, the Meet the World, for instance, the 4th of July, Unity Gala, and then we collect and gather and share information regarding community-wide events, and then celebrating the cultures and welcoming the new citizens and families to Anchorage. We engage community members, and so we provide opportunities for volunteering, youth mentoring, networking, fundraising that positively impacts our community. We celebrate diversity, we recognize individuals and groups making a difference in Anchorage and awarding scholarships. Well, that all ended when we had to do a lockdown with COVID-19. We had, everything became, for us, it became silent. We were We have our board members are all members of the community who have connections with other community members, groups, and we gathered, and we just had real concerns, for instance, about people being isolated, concerns as Robin mentioned, domestic violence. We worried about all the other concerns. We had unique cases. For instance, we worried about international students who are at UAA, who were stuck, who did not have the stipend, the resources, and to travel even home when this happened. We have concerns with the elderly while everyone is connecting on Zoom, and we had to reach out to people who we didn't hear from for a long time and go in and teach them how to connect with Zoom, or just to connect to see how they're doing. So the next part is, it would be all our events have come to a standstill. We try to fill the gap because we are a non-governmental entity, we are nonprofit, but people come to us at these events, and it would be a casual, fun festivity, but then they open up to us and tell us the problem. And then we can reach out and seek out the other nonprofits to help out. So this is what all I have to say. Thank you for giving me the opportunity to speak on behalf of Bridge Builders. Thank you for giving us the opportunity here for the roundtable, and we will continue with the dialogue. Thank you.
Great, thank you so much. Next, we have Aaron Leggett, the president and chair of the Native Village of Eklutna. Aaron, are you with us? And if you're on the phone, it's *6 to unmute yourself. Okay, we'll come back to Aaron in a little bit. So next we have Liz Medicine Crow, the executive director of the First Alaskans Institute.
Hi, can you hear me?
Yes.
Oh, great. Great. Well, Ganesh Chish, how thank you for holding this convening and getting everyone together. It's been great to listen and hear all of the amazing advocacy that everyone is doing and involved in. And Ganesh Chish, how for inviting us to participate and share some information about our community. I'm not too familiar with how Teams work, so I'm trying to make sure that hopefully people can at least see me.
Yes, we can see you.
Okay, great. Thank you, Felix. So I guess I just want to say, just to make sure that you know who I am. I'm Tlingit and Haida. I come from Southeast Alaska. I'm from Cake. I'm actually in Cake. I've been here since mid-March. And our organization, First Alaskans Institute, is a statewide Alaska Native nonprofit and an operating foundation. And our vision is progress for the next 10,000 years. And I want to say, again, Chinan in the Dene'ina language, for the land acknowledgements and the recognition of the Indigenous people of this state and of Anchorage in particular. That's really an important step forward. And also in everyone's advocacy as you are engaging in your work, your critical work. bringing that level of acknowledgement and recognition and support to our Native peoples is also really appreciated. So, Ms. Chisha, thank you for that. Our organization has one office, and it's in Anchorage, actually just a block away from the Muni. And we have been closed at the location, and our staff has been working from home during this pandemic. And I wanted to start with what we're doing as an organization in terms of how we're responding to it from the inside out, if you will. We know that our Native peoples are the most vulnerable to this disease right now, just by virtue of being born Native. Then add on top of that, all the immunocompromised people who make up our families and communities, our intergenerational households, the high number of ACEs scores, and we think about ACEs as adverse cultural, collective, and childhood experiences that our people have had to endure and survive through. And all the other things that we've had to be resilient over in order to just be here today, to have survived everything that's been thrown at us and still be here. It means that we are at a critical level of vulnerability. And in thinking about how to be responsible through our work to our staff, our trustees, and especially our community, we've made the decision to take it very slowly and to watch what's happening and to learn what's happening as other people open their doors and re-engage in business as usual. We can't risk it. We cannot risk it. And so we're watching our communities, our tribes across the state. We're really the first responders in taking policy action to protect our villages and our communities. And I just really lift them up for that and recognize that unprecedented amount of policy making happening through tribes and our Native nonprofits in order to protect our extremely vulnerable communities. And even if, even if others are opening and are testing it out, we know that these things might retract as well, as was mentioned earlier. So we're taking it slow. We're taking it very cautiously. And in order to be responsible to our community, we have to do it that way. We have moved everything virtual. So we are still conducting our gatherings, our convenings. We're just doing them through the virtual space. And that has a huge learning curve, as all of you know. But it's really critical for us because, especially as Native people, working together, building consensus, strengthening relationships, and being able to be who we are as Native people is actually what keeps us strong. It keeps us healthy and it keeps us active. And all of those things are quote unquote prevention measures to fighting any disease, any sickness, and in particular, COVID-19. So some of the things that we're hearing about and learning about from our community have to do with the same kinds of things that existed before, but are now just exacerbated, right? So racial equity issues, who gets listened to in terms of state and municipal governments making decisions, and who they bring in to listen to in terms of the concerns, or how those sovereigns actually work with tribes as sovereign governments to create a network of safety for the communities to be able to protect their citizens. That has been a gigantic failure across the state in terms of being able to do that. And I think that where we see it, and there's an inequitable way that it's happening. So some places that are in the interior, for instance, have been able to have and set up roadblocks into their communities who are off of the main road system, and there hasn't been any real issue with that, which is good. But when the communities on the coast are being forced to open, they're not getting that same level of respect and treatment, and so there's some real problems there. In terms of our Native community and the municipality of Anchorage, many folks have already hit on the same kinds of issues that our people are dealing with. But therein lies a really unique solution to a lot of things, is that I think our Native community has, we've survived a lot in Alaska. And so we come to this pandemic with a different way of approaching it. And I think that that strength can and should be tapped into at all levels, and bringing new perspectives or ways of doing things forward as well. I think that that's an inherent strength that could really be helpful. So an added value to all the work that's happening. We have been working actively with a group of advocates across the state for protecting our ways of life, our hunting and fishing, and our abilities to provide for our communities and steward our lands. And even if our Alaska Native peoples in the city may not have the ability to go out and harvest this summer, they still have family out there who would probably be able to help. But the problem is that as people experience, joblessness in the city, rent issues, all the bills go unpaid. They also get themselves out to their communities to harvest foods, which they live on throughout the year. And so this group has been really active in working on a different approach to solving what some people call subsistence, but subsistence is really just, it's really not the right word for what it means to us and what it actually is. And so we're trying to come up with some different ways of solving this issue, and it would be wonderful to have some partnerships and some solidarity from our brothers and sisters and your organizations across the city, because I think it's Alaskans working together who can really solve this and support our inherent Indigenous rights to hunt and fish on our lands and waters. And those things increase our immune system, they increase our activity level, they decrease socially detrimental behaviors and outcomes. And that would be really incredible to have that level of support from our fellow Alaskans, especially now. The other is that when it comes to summertime, generally across the state, we have all kinds of culture camps. And even within Anchorage, there are different organizations that support culture camps within the city. And those culture camps are having to innovate new ways of delivering access. And ensuring that our kids, since they don't get this in schools yet, making sure our kids have access to learning and living our ways of life. And there's so much education and richness in those activities. So they are reconfiguring how they can deliver those things virtually. And something that's a strength in that is that it also is going to create a lot more virtual content, so more people can actually access it than just those who are able to be physically present in the community. So Culture Camp leadership is also thinking about how do we make sure we protect our knowledge, but also share it in good ways. And those things are going to be really critical activities that families and small groups of people could do in a socially distanced way, no matter where they live across Alaska. So those are a couple kind of strength-based things that we're really focused on. We also have a summer internship program that happens every summer. And obviously we've had to retool that, and that's going to be mostly delivered virtually as well. And we are really lucky that many of our partners, and I know there's a few on this call as well, are very flexible and allowing interns to conduct their internship remotely, which is really exciting. So there's some good things happening despite the bad things. And I know that we have major concerns around our prison population. We have major concerns with the census. We have major concerns with voting across the state, but also specifically in the Anchorage area. And we have some incredible organizations and advocates who are working in those areas. So if others are touching on those areas and they want to be able to have the benefit of having Alaska Native voice and representation in those efforts, please let us know and we can make sure to help connect people together, because there's some really incredible folks doing work out there. And I think that's really all I want to say right now. I know we're getting short on time, so Ganesh Chish Hawa, everyone. Thank you.
Thank you so much. So I am going to go back and see if the three presenters who weren't here, if they've joined us. If not, I will ask them, even though it won't replace hearing them in person, ask them to provide some written remarks. So I'll start with Jennifer Gates, President of the Alaska Deaf Council. And for Assembly members, you will recognize that last name. That is actually Jennifer is actually the partner of Dean Gates, our Assembly Council. So hopefully we'll hear from Jennifer later. Then we have Kevin Mcgee, President of the NAACP Anchorage branch. And then last, Aaron Leggett, President and Chair of the Native Village of Eklutna. Okay, well, it's unfortunate that they couldn't join us today, but like I said, I will try to get some written remarks from all three of them so that they can share their important perspectives. So I see I have one Assembly member in the queue, and then we might have time for a couple of questions. After that, then I will turn it over to our next panel on impacts on our elder population. Before I turn it over to the queue, I really want to thank all of our presenters for speaking today and sharing all of the different important perspectives so that we are knowledgeable as we move forward on how we want to work in this area. So I'll go ahead and turn it over to Ms. Allard.
Thank you, Chairman. So my question is for Robin. Is she still on the line by any chance?
Yes, I'm still on the line.
Hi. So
Hi.
I'm just curious on I just wanted some clarification on some of the things that you brought up. Are you asking the municipality or the assembly to consider giving funds to illegals?
What I am asking the assembly to consider is focusing on crime victims. So, as I mentioned in my remarks, the majority of the people that we represent, provide legal representation to, are immigrants who are victims of domestic violence, sexual assault, and human trafficking, usually at the hands of United States citizens. And under the law, the federal law, these individuals are eligible to get their immigration documents because Congress understood that it was critical for crime victims who were immigrants to come forward because it protected our entire community, similar to the virus, where the virus can affect anyone. A perpetrator of violence doesn't necessarily know the immigration status of the person that they are attacking. And if we do not provide that legal representation to immigrants who are in that situation, that perpetrator of violence could also hurt us.
So is that a yes?
No, it's not a yes.
I mean, okay, so let me just state that as a daughter of a Chilean who came over in 1958 and became a U.S. citizen, and as a Chilean first generation born here in the U.S., I take offense when you were commenting in regards to them being immigrants versus illegal and coming to the municipality in a lane that I don't believe, have authority to just hand out money to illegals over U.S. citizens. And my concern is you are bringing up the federal government into our conversation. We're a nonpartisan assembly, and I just find we should kind of leave politics out of it. And I take a great offense to what you had laid out in this, and that with my background and my upbringing, as my mother is still working towards being a U.S. citizen, I just think that this probably wasn't the forum in order to get your political point across. Thank you, Mr. Chair.
Thank you, Ms. Allard, and for sharing your perspective. And I just want to acknowledge the variety of perspectives that we have on the line. So just want to note for the record, we've been joined again by Mr. Weddleton, Mr. Constant, and hopefully by Ms. Zolotel as well. I know the three of them were in a meeting. And then I just want to read a quick comment from Barbara Rath. Thank you, Assembly members, panelists.
Excuse me,
Leave the meeting. If there are any further questions.
Excuse me, this is Robin Bronin. May I please respond?
Sure, I will give you a second. I just want to finish this comment that I'm reading, and just give me 1 second, Robin. So just to finish up that comment from Barbara Rath with the Arc of Anchorage. If the Arc of Anchorage can be of help, please let me know, and please stay healthy, and safe. So that is from Barbara Rath, CEO of the Arc of Anchorage. I will go ahead and turn it over to a brief response from Robin.
Thank you, Assembly Member Rivera. So just in response, thank you very much for that comment. And it is exactly because of that comment I was invited to speak, because we're talking about disproportionate impacts, and your articulation of your sentiments are the reason that people in our community who are crime victims are afraid. So I really appreciate the opportunity to talk about what's happening in our community with the people who have unfortunately experienced victimization, crime victimization, and are just seeking justice. Thank you.
Thank you. So I'm going to go ahead and move us on to our next panel on elders. So we have two folks to present, and on this panel, we are going to be hearing again from Rebecca Parker, who is the Executive Director of the Anchorage Senior Activities Center. Yesterday we heard from Becky on her nonprofit, specifically on some of the operations at the Senior Center. Today we're going to be hearing a different perspective on impacts to our elders, and I'm looking forward to what Becky has to share.
Thank you, Mr. Chair, and good afternoon, everyone. I've been looking at the topic for, I've been going back and looking for the past few months about the topic that I'm addressing today. And we have many impacts on seniors because we are such a vulnerable population. So one of the major impacts is isolation. And some seniors believe that they need to social distance themselves and are completely social distancing, isolating and sinking into deeper depression, anxiety, loneliness. So we're seeing a lot of that and hearing about a lot of that. We have staff who are actually calling our seniors because we've also received many calls just in my office from people who are depressed or anxious and lonely. And I've had many conversations with different members of the senior center. I wanted to also mention that the Washington Post ran an article this week. The Census Bureau reported that 1/3 of Americans are showing signs of clinical anxiety or depression because of the COVID pandemic, which has taken a psychological toll on Americans. And among those are our seniors. So we want to really keep in mind that social isolation can have a negative impact on older adults. Not only our immunity, but mental health, along with the anxiety and depression. Now, some of the seniors are reducing significantly their social interactions, and there are many kinds of social interactions. For instance, a daughter who used to come daily to visit her mother and help her with her shower is no longer allowed to visit the long-term care home. And that's very stressful for both the daughter and the mother. Some seniors we see are relying on someone to come into their home and help with housekeeping, bill paying, and other needs. And if someone isn't coming into their home, suddenly can't come, what happens if the unpaid bills is for an essential resource or accrues a lot of interest during this time? It's a huge impact on a senior. One of the things that I'm seeing here at the Anchorage Senior Center is that many seniors who were receiving tax aid from AARP with the closure of, with the pandemic, they are no longer able to get that aid. And so as a result, we've had lots and lots of calls from people. I've talked to Teresa Holt at AARP, and I know that they are now offering online services for anyone who needs help. So you may I'll just direct you to their website if you know of anybody who needs tax aid. Also during the closure, there is a lack of assistance for medical help and needs. I have an 87-year-old woman here in Anchorage who decided that she was going to give herself her own pedicure, clipping herself too closely. She thought it was not a big deal. And suddenly her toe began to hurt. And after a couple weeks, she called the doctor for an appointment. He saw her this week, and she had a very bad infection and came very close to losing her toe. And he was just about ready to amputate it. So I just want to say that we're seeing all kinds of things happen, because one of the things she said was, that she just didn't want to call anyone and bother them during the pandemic, and really feared going to the hospital. So that's why it took so long for her to finally come to terms with that she needed to see a doctor. Anyway, he did save her toe. We're also seeing deterioration in nutrition and exercise. It is suggested by health experts that older adults need a minimum of 150 minutes a week of fitness or strengthening exercises. And we are offering those Zoom classes here at the Senior Center for fitness. And it's been working really well, and it really works well if you have technology. But I can tell you that a lot of our seniors do not have the technology or the knowledge to use a computer and even a cell phone. We do offer those classes during normal times. So we're really encouraging, and we have a beautiful computer lab. So I'm really encouraging anyone who has a senior friend who needs training, that we would be happy to offer that. And there's no cost. There's no cost for using the computers, and we have a beautiful lab, and all the printing is free. So it's a real gift to be able to come here and use the computer. We know that more seniors are watching TV more than ever and eating our favorite comfort foods, desserts, and snacks. I think I just finished my 5th container of chocolate covered almonds. So I'm one of those who has been taking advantage of this time and enjoying some of the snacks that I would normally not eat. We also know that there are seniors who are lacking transportation. I have another friend who was waiting to be fitted for a hearing aid, and when Anchorage suddenly closed due to COVID, she wasn't able to get there to the doctor. So then the doctor's office closed, and so now she had no ride. Now the doctor's office is closed, and she's nearly deaf, and we're just anxious for Anchorage to start up again and for her to get to the office and get those hearing aids. So anyway, we have all kinds of things that are, we know are not happening because of lack of transportation. We have talked to a couple of seniors, and they have also lost their personal care providers. There just aren't enough PCs for all the seniors and all the seniors who need assistance right now. And then as time goes by, we are seeing increased stress and loneliness from the seniors living in senior living homes, assisted living, and long-term care homes. I have a friend who just moved into the new Aspen Creek Senior Living Home on DeBar and Lake Otis. It is considered a very lovely and well-run senior living home. When COVID-19 was announced, they closed the home to families, friends, and visitors, and as a result, everyone is safe, which is wonderful. But I can tell you the residents are feeling stress and loneliness. We've all heard of stories about how families who come to visit can only stand in the parking lot and blow kisses and wave and say hello through the window. Last week, my friend, closest friend, showed up with her cell phone, and they had a long conversation looking through the windows at each other and talking. But it was really better than FaceTime, and I think it was a long overdue visit. So I know everybody felt really happy about that. All meals are delivered to a room, and there are no communal meals. And this is impacting a lot of seniors who are used to going in to dine with others and are all of a sudden eating alone in their rooms. And for many of them, I've gotten calls from people who have called me and said, would you be my mother? I have no mother and I need a mother, and I'm absolutely, I'll be your mother. I've just had people very lonely and calling the senior center. Other impacts that we're seeing on seniors is senior fraud is on the rise, especially when the $1,200 checks were mailed to seniors across the country. And some were, basically called and asked to sign their entire check over to the individual for various reasons, but they were all fraud related. And we see that as a real increase. There's also added stress for those living on fixed incomes and seeing grocery prices increase while their assets decline. So I would just like to say that at the Senior Center, we have been focusing on what we can do to keep seniors connected. We have the Zoom classes for the fitness and exercise, nutrition education, our memory cafe, which is helping those who have the onset of dementia or Alzheimer's. We have a full-time Medicare counselor available by phone appointments Monday through Friday. And we have a Medicaid benefits enrollment center, which is also taking phone appointments. And we are working with the Food Bank of Alaska in distributing food boxes, vouchers for fruits and vegetables. And we remain to contact, we have about 2,000 members, and our staff has been working around the clock, just calling our members and maybe making sure that we check in on them and that they're okay. And I just want to say that we're making every effort to stay connected with our seniors. Thank you. I'd be happy to answer any questions.
Great, thank you so much for sharing the stories that you are hearing. Next, we have David Washburn, the publisher of the Senior Voice, to share what he has been hearing.
Yeah, this is David. Can you hear me?
Yes, we can hear you.
Yeah, I was going to fill in for our executive director, Jim Bailey, who I believe is also online and was planning to speak, but I'll just make a couple of quick comments. Rebecca's notes were very thorough and definitely reflect the things that we've been seeing too. The timing with the initial restrictions and things escalating with the taxes. We got so many calls regarding that tax aid program. At Senior Voice, I'm the editor of the Senior Voice newspaper. I'm sorry, I forgot to mention that. But yeah, we heard a lot from readers about that. We publish monthly a print edition, and the closures did have a pretty significant impact on the way we distribute our papers and get the news out. We direct mail a large number of them, and in fact provide them free subscription to low-income people. But over the years, we've built up a pretty large list of locales around town where we drop off bundles for people to pick up. Many of them were restaurants, clinics, and other public areas that were closed. So our coverage has dropped off as that happens. Now that places are starting to open back up again, we're going to be able to get more of those papers out. During this time too, we stepped up our coverage on our website, which is a digital version of the news that comes out in our print version, and is usually based on a month-long cycle. We added a special section specifically for COVID-19 related information and posted more updates throughout the month to try to speed up the news cycle to keep more current information out there for people. And we have a very active Facebook feed that we've been using to post updates and share different events and information that we get from different agencies as well. One of the other questions that I did hear from somebody was the question about how people on low fixed incomes who receive benefits could be affected by some of the temporary, like the stimulus payments and other benefits that could throw their income, out of whack in terms of levels. So there are some other more subtle issues that come into play there. But yeah, pretty much the different things that Rebecca described were definitely things we're hearing about too.
Great, thank you so much. Thank you. So I didn't know if Jim Bailey was going to be able to join us. Mr. Bailey, if you're on the line, we'd love to hear from you as well. And Jim, if you are on the phone, it's *6 to unmute yourself. Okay, looks like Mr. Bailey may not have been able to join us today. Well, thank you so much, Becky and David, for sharing some of those insights. Do Assembly members have any questions? Great. If not, then I want to thank you so much for highlighting additional community impacts on some of our populations within the municipality. Next, we're going to focus on impacts on victims of DBSA and suicide. So we have 3 presenters for this panel. First, to give us a review of the data that APD has been getting and the calls and what we've seen on the ground. We have Chief Justin Dahl with the police department. Chief Dahl, are you with us? Okay, I will circle back to the chief. Maybe he'll be able to join us a little later. So we have 2 of our community organizations. Oh, looks like the chief actually maybe just got online. Chief, I see that you're here as a participant.
Yes, sir, I'm here. I thought I was on for
Okay.
3:15, but if I missed the timeline, I sincerely apologize for being tardy.
You are correct. It was 3:15. Very precise of you. We're a little bit ahead of schedule, though.
Oh, okay. Well, that's always a good thing.
Yeah, I had actually just introduced you and the topic presenting today on anything that APD has seen in terms of calls or trends or anything on the ground regarding DVSA and suicide.
Yeah, so I did, thank you. I have some data that I pulled, and I'm gonna see, I'm not sure if I'll be able to share it from my tablet here, but essentially with the overall trend we've seen so far this year is in almost all of our calls for service is that we're slightly down, especially compared to the last 2 years. And that includes domestic violence, suicide calls, sexual abuse of a minor, sex assault. And that trend actually started before we started seeing the impact of coronavirus in our community. And so we sort of thought that was pretty interesting that trend was beginning anyway, and it continued through really the hunker down orders for coronavirus. And I find it especially interesting because I have some friends and associates that are police chiefs in other mid-sized cities across the country, and that was not the case in every location. So I think that we've been fortunate that that's kind of what we've seen, but I'm trying to actually locate that data now. I thought I was going to have another couple of minutes, so I wasn't quite ready. But I'm always happy to answer questions.
Sure, Chief.
If there are specific questions about exactly what that looks like.
Sure. Actually, what I'll do is I will turn it over to our other two presenters on this panel, and then I'll come back to you after.
Okay, that sounds great. And I managed to locate the information that I put together, so I was just sorting it differently.
Okay, great. Well, if you have it and you want to talk about it now, I'm totally fine with that.
Okay, so let me just throw in a couple of numbers to give sort of, I guess, some context to what I just said. So, for example, our domestic violence writ calls for service, so restraining orders, from March 1st to May 24th of 2020, we saw 291 of those. For the same period in 2019, we saw 308. So just slightly more. And then in the same time period for 2018, we saw 394, which is, about 30% more, so substantially more. For sexual assault, for that period that I mentioned, March 1st to May 24th of 2020, we saw 115 reports this year compared to 148 reports same time period last year and 149 same time period in 2018. Sexual abuse of a minor, 78 reports in 2020, 118 in 2019, and 129 in 2018. And again, that's that March 1st to May 24th time period. And so, one final thing that I'll throw out here in this particular category, what we call domestic violence information reports, which are a report of domestic violence where maybe there wasn't enough information to make an arrest for any one thing, but we took a report anyway. 41 this year, 43 last year, 46 the year before. So as I mentioned, just kind of slight declines in all those areas. For calls where the police department was involved, and we took a report or we classified the call for service for suicides during that time period, March 1st to May 24 of this year. We had 620 calls for service, 655 last year, and 723 the year before. So I have this information also for like disturbances, assaults, property crimes and stuff. So I'm happy to dig into that a little bit more. I don't want to put everybody to sleep by regurgitating a bunch of numbers. But I think that kind of captures overall sort of the trend that we're seeing, which is generally slight decline this year, which we're totally happy to see.
Great, thank you, Chief. So I'm going to go ahead and turn it over to our two community organizations to speak from their perspectives, what they've been seeing, and any insights that they can share with the Assembly as we work on our COVID-19 response. So first we have Susie Pearson, the Executive Director of Abused Women's Aid in Crisis.
Thank you, Chair Rivera and Assembly members for inviting me here today to represent Awake. I'm going to go over a little bit about some of the experiences as far as what a domestic violence victim, the risks that they're experiencing through COVID, the impacts of COVID-19 and isolation, as well as a little bit about what the community can do, and then a little bit about what Awake has done since the pandemic has begun. So as many of you do know, that domestic violence is rooted in power and control. Abusers use tactics to intimidate and control their partners to get their own needs met. These past 2 months we've seen have been extremely challenging for our entire community, and we all feel a bit of a lack of control. During this time, in order to maintain control over their victims, abusers will increase their tactics, which increases the lethality to the victim. There are multiple ways for an abuser to gain power and control, and that is through mental, physical, and/or sexual abuse. Isolation is an incredibly useful tactic and is generally done by isolating the victim from their children and their children from friends and family, or possible help by means of threats, intimidation, and innuendo. With the COVID-19 pandemic, victims have been trapped in their homes with their abuser and the inability to reach out to others safely. With the guidelines in the stay-at-place, many victims are now unable to go to their friends or family because it may not be safe for them to go there based on the health of themselves, the health of their family members. They may be in an at-risk category or elderly. And as such, having a safe place to go is not necessarily an option for them as an alternative to shelter. Some abusers withhold access to phones, computers, or other communication devices. They've been known to withhold items such as food and support for medical assistance should they become sick. One abuser even threatened to kick the victim out of the home if they started to cough or show signs of illness, and the individual wasn't sure where to go or how to seek support. It took us quite a bit of effort to make sure that individual understood the safety measures that we could put in place for them. There are several risk factors that increase the potential for lethality in the homes of those as far as when it comes to unemployment. As we know, the unemployment rates have reached over 20%, and the stress of one's unemployment creates more stress in the relationship and the need for the abuser to maintain even tighter controls over the victim. It is a huge risk factor when we're talking about the status of an abuser's employment when we're discussing the lethality of victims. So that's something to consider as well as an impact. Part of getting to safety, the development of a safety plan, it's difficult to enact a safety plan if one is constantly being watched or does not have access to communication devices. It's also difficult if you don't know the resources in the community. During this time, some weren't aware of the level of support Awake in the community were providing to victims and those at risk of exposure to COVID-19. Some were not wanting to come to shelter because of the communal living setting. As such, our demand for shelter has been down. Something to think about is that some victims are still working in the public, and this is a key time for employers to be aware of how employees are doing and what they can do to help. Ask if employees are okay and how things are going at home. Pay attention to the fact of their partner's possible actions regarding unnecessarily calling or coming to work often. Let your employee know you care and are willing to help them should they need any support. Give them time and a safe place to call someone for support or call the Awake crisis line. And while you're updating other policies in response to the pandemic, why not think about your violence at work in the workplace policy? Ensure employees know what to do if an intruder enters the property because of high lethality for victims. Family and community members can support those in their lives that they know are at risk or have concerns. As they say, if you see something, say something. And in this case, If you have concerns, let the person know that you are there for them. Reach out and share the resources you know. Awake has experienced a 31% increase in the number of crisis calls in April of this year compared to April of last year. We have dealt with several suicide calls as well as calls for requests to send APD to people's homes. We have seen a decrease in the demand for shelter because of some of the reasons stated above, however, have continued to see the need for other services continue. As an essential service in the community, Awake continued operations during the pandemic. Awake did reduce its shelter capacity in March, like so many other shelters, moving to the CDC's recommended 6-foot distancing for sleeping and interactions. Awake has 13 rooms and as such only had one family or 1 or 2 single women in each room. Staffing levels were reduced to minimize overlap of staff, and at this time, Awake will continue to use those CDC guidelines for our shelter. Awake has continued to provide safe shelter to victims at an alternative housing site. So those who are still in need of shelter, we are not turning them away. We are making sure that they have another safe place to go to, and we've continued to provide case management and support for those individuals, as well as food and basic needs. We've also been able to maintain services regarding our non-residential participants, those who are maybe not in need of shelter, but in need of support and case management. We are continuing to provide walk-in support for those in need of support, as well as transitional housing and rapid rehousing. We've been very busy in our rapid rehousing program. We will continue to provide these services moving forward, no matter what phase we're in. So as far as the government. So that's pretty much what I've got for you here. Thanks so much for your time today.
Great, thank you for sharing. Next, we have Kaylee Olson, the Executive Director of Standing Together Against Rape.
Hello, thank you very much for having me. Thank you, Assembly members. Thank you, Mr. Rivera, for the invitation. It's been a very valuable discussion for me to listen in on thus far. Happy to share from the perspective of STAR. I'm Keely Olson, the Executive Director of STAR. For those who are unfamiliar with our services, we are the only standalone sexual assault comprehensive trauma prevention and response center in the state. Annually, we serve approximately 1,200 individuals and families who have experienced sexual trauma and provide prevention, programming, and education to approximately 6,000 community and state residents. We operate the statewide sexual assault crisis line, which is the heart of our work. We respond 24 hours a day to emergency reports of sexual assault with law enforcement and forensic nursing. Here in Anchorage, while we are a statewide agency, we predominantly are serving residents in Anchorage or those who have traveled to Anchorage and have been harmed while here. While the numbers of emergent reports have been lower than average during the community and state safety restrictions and closures, we sort of expected that. The majority of the people that we serve are not in intimate partner relationships and incurring the violence. The majority of the victims and survivors that we serve are harmed by acquaintances, friends of family, people that they don't co-reside with. So we certainly did expect for those numbers to be a little lower. We're at about half of the number that we would usually be for emergent responses at this point in the last 2 months. However, the number of crisis line calls for support rose significantly. Isolating can be very trying for survivors of trauma, as we've all recognized, it's trying for all of us. But for many survivors, they seem to lose access to their usual coping strategies almost overnight. Access to gyms, pools, close contact with family or friends, their support network, and finding their normal routines uprooted and drastically changed. That can be very triggering for a lot of people. They may have a history of depression and anxiety that kind of goes hand in hand with their trauma. So our crisis line has been offering critical services, offering support, and our trauma therapist has been working diligently to provide telemedicine appointments for cognitive behavioral therapy and EMDR therapy. Our advocates have been responding to emergent cases as well as providing ongoing support to the survivors that they work with. Each of our direct service staff have their assigned caseloads, and our case manager has their caseloads, and they are all working diligently remotely to follow up with the people that they're working with. STAR's prevention team has provided personal safety presentations for youth and families throughout the state, most notably to over 120 students in the Kodiak Island School District. During these closures, we were invited by the school to provide some personal safety and prevention strategies and information about consent and sexual violence. We are preparing to reopen our office space to the public June 15th, but we'll need to limit our staffing in office and rotate our staff to allow for social distancing. STAR was already in the planning phases and had received some funding for a capital project and office expansion to create more space to meet with clients and add direct service staff, which we definitely need. We foresee that will remain critical in the near future. However, we are also seeing, as has been stated by some of the presenters already, that a lot of our funding sources are redirecting funds directly to COVID-19 sorts of needs and not really looking at capital projects. So combined with the fact that we had to cancel so much of our fundraising that was scheduled for Sexual Assault Awareness Month in April, and looking forward to the future, not being unclear as to whether we'll be able to hold our annual gala, which brings in a big portion of our funding for the year. We're not confident that we're going to be able to continue with that expansion at this point. We expect to see more reports coming in as community restrictions are lessened and people have the opportunity to reach out for help, and reports of harm are able to be made. As Ms. Pearson stated, isolation dramatically reduces protective factors, particularly for children and youth. With school closures and the closures of childcare, we know that abuse and neglect thrives in isolation, and when victims are kept away from safe, trusted adults who can intervene on their behalf, we expect as Anchorage reopens, and particularly when youth get back into school, that we will see a surge in reports of harm, and the need for advocacy and support for those youth and families will definitely be on the increase. We receive limited funds from the state and the municipality for emergency client assistance, and we've been using that to help the families that we work with on emergency relocation, rental and utility assistance, transportation costs, food costs, anything that we can do to offer crisis stabilization to prevent families facing disclosure of harm to one of their children from spiraling into chronic crisis, potential homelessness and joblessness. I foresee in the future needing additional emergency client assistance and case management funding to stabilize families. Again, also seeking to increase our office accommodations, which we already knew was a need. Over the last 2 years, as Chief Dahl noted, we saw a significant increase in reporting, but given that we work with survivors who may not have reported, in 2018, we had a 70% increase in office visits asking for support and a 20% increase in our crisis line calls. Last year, we responded to a record number of emergent reports. I believe it was up from the record previously held in 2016 of SART responses was 260. That number increased last year to 322 cases. While we've seen a slight dip in reports during the lockdown, it hasn't been as significant enough decrease to change those statistics over the course of the year. I will say that I want to focus on some successes. I think all of us have learned a great deal about being able to respond remotely, that we have rallied, that we have diversified our efforts. For the first time, we got telemedicine underway, which I think will be incredibly useful as we work to expand services for people throughout the state, that they don't have to necessarily be in office, especially since we don't have the room to accommodate everyone. When we have had those increases, we've had to limit the number of office visits and actually reschedule people, so we weren't able to meet all of the needs that people had when they presented. But we were able to get an $18,000 technology grant from the Mental Health Trust that helped us to secure iPad tablets and laptops for all of our staff. So when we initially went into lockdown, we were, everybody was just making do with what they had on hand, and it was very inconsistent. So we see that as an opportunity to really grow our services in the future for those that may be homebound or aren't able to get to us for services, that we have more technology and knowledge of using that technology to support them remotely. And that can be helpful with people regardless of, transportation issues or childcare issues. So we see that as a success moving forward. And I'd like to thank you for the opportunity to be here today and to discuss these matters. And thank you for being proactive in your approach. Thanks to the entire Assembly for that.
Great, thank you so much. And thank you to all of the presenters. We're gonna go ahead and move on to questions, starting with Ms. Quinn Davidson.
Thank you, Mr. Chair. And just to share with the public what was on the chat screen, Ms. Hussein had chatted, hello, I have a question for Chief Dahl. Are the numbers down due to underreporting? I had put my name in for a question after Chief Dahl had given his presentation and before I heard from the others. It sounds like yes, that I guess, Keely and the woman who spoke before her believe that there isn't a downturn in cases. It's just for some reason that folks aren't calling the police. Can you speak to that? I think it's confirmed, but I just want to make sure.
Hi, so this is Justin again. I mean, to be honest, I don't know that there's any way to really prove that. It is interesting hearing from some of the other providers if they feel like they've had an increase, but we're seeing a decrease, that maybe people are turning to them instead of us to report. So, I suppose that's possible, but it's hard from looking at what we have, to make that determination. I will say that it's consistent across the board in almost every crime category. So to me, that feels like, that's something other than underreporting, but I guess I don't know for sure is the best answer.
Yeah, thank you. And I was actually asking the service providers what their view is too, because they're actually interacting with these folks that maybe aren't filing a report. Can you speak a little bit to that?
This is Susie Pearson again. In response to your question, we did analyze, initially there was a drop in our crisis calls in March. However, in April, we saw a 31% increase in our crisis calls. And so for us, we feel that there was a dramatic increase, and that was in response to the need for support. Our crisis line responds to all sorts of calls for requests for information, as well as we've had participants and community members call us, and with suicidal ideations, we've had to call the police several times. And that is what we are there for as a crisis line. But we have seen an increase in the calls for, as far as that's concerned. But as far as demands for our shelter, that has decreased.
And this is Keely with STAR. I would just say that the calls that we've been receiving on our crisis line are not necessarily emergent situations, but we do provide support for years for our clients. As you may be aware, sometimes it will take 3 to 6 years for a case to get to prosecution. So people are still reeling with the effects from incidents that happened many years ago. Maybe they are calling because being isolated and away from their primary supports, that they are coming to grips with historical trauma that they've experienced as a child. So they're reaching out for assistance. So I don't want to say necessarily that the calls that we're receiving on our crisis line are in regards to ongoing current crimes that have recently occurred within the municipality of Anchorage. We also are a statewide crisis line, so we take calls from all over the state and sometimes out of state.
I think, and this is Justin again, I think that's an interesting point that, talking about some of these things are historical. And I think especially, highlighting that the support from the crisis line goes on for years after the incident is interesting. And I think when you think about how coronavirus affected a lot of people and the lockdown and the increased stress and anxiety, it's interesting to think about people accessing those services more frequently. And it does make me sort of wonder if some of that is people that have historically, had incidents that they're still dealing with, and the increased stress, caused them to reach out again.
Can I ask a quick follow-up, Mr. Chair?
Sure.
Chief, did you, I forget when you gave the presentation, what months you had data up until? Was it the end of March or did it go into April?
It was the period that I was referring to as March 1st through May 24th. And I am going to attempt to put those up on the screen here and see if that works.
Yeah, I was just wondering if maybe it didn't
Nope.
include.
It's not going to work.
It sounds like either way, there's some discrepancy between what's going on at the department and what the needs are in the community for the service providers. So anyway, thank you.
Yep.
That's helpful.
Thank you. Mr. Constant?
Thanks. Yeah, and I might have heard something slightly different, that the call for support is going up at these shelters, these service providers, because the needs are extreme, but that isn't that the incidence of violence or other factors are going up. It's because of the extraordinary need in every direction. That's kind of what I would take away from it without further information. But Chief, question for you, especially as relates to the suicidality issues. Have you redeployed teams internally to address this during COVID, or how have you responded during this short term to address these issues?
Is your question specifically related to suicide, or I'm not sure
it
if
starts
I understand.
there, but really it's more broadly, how have you redeployed your assets, your people in relationship to these issues that we're hearing about? But yes, suicide is the one that comes to mind.
Okay. I mean, honestly, we haven't, because mostly the numbers that have been reported to us have been declining. So I can tell you that throughout the, especially the sort of the main, I guess what I would call the main event in Anchorage, where we were under emergency order, people asked to stay at home and really sort of anticipating a major crisis. This was something we looked at on a daily basis as a command team. Are we seeing a shift in need in the community? Do we need to make deployment changes? Are we starting to see a surge in certain types of calls? So this was something that was basically a daily evaluation inside of APD. And ultimately, we really didn't change our deployment strategy because we just didn't see huge changes in the numbers that indicated that one particular area or another was surging in a way that it required some sort of special attention.
Thank you.
Thank you. Any other questions before we move on? Okay, not seeing any. I really want to thank Chief Dahl, Susie Pearson, and Keely Olson for presenting on that very important topic. So our last panel, and thanks everyone for sticking with it. It's been a long few hours. So our last panel is talking about workforce training, and I want to provide a little preview before I turn it over to, actually it was a little bit of reordering. So Denise is going to start, and then we'll go to Joelle after. So a little bit of preview. This came up at the Business Roundtable last Friday, where Bill Popp, the president and CEO of the Anchorage Economic Development Corporation, talked about this, specifically talking about the workforce being displaced, and certain skill sets not being as relevant as they may have been in the past, that leading to the need for retraining in a data-driven and research-driven way so that we can better understand the demand into the future for different types of workforce training. And so with that, Bill Popp talked a little bit more specific in detail about the research need, specifically around recovery of certain workforce types, what future demand might look like, displacement, and the ability to reskill our workforce. And with that, he did talk about the need to, in his opinion, put out a contract to better understand what that, and do that type of research. So just wanted to do that as a matter of preview for this panel, and I'll turn it over to Dean Denise Runge of the UAA Community and Technical College.
Well, thank you. Thank you so much for the opportunity to join you today and to tell you a little bit about what has been happening at UAA with respect to career-focused programming and some of the things that we are doing trying to respond to the major disruptions that are going on in our economy. First, I did want to let you know that the university has seen a slight loss of enrollment. That's to be expected as we made the shift just as the spring break was occurring to remote delivery. And particularly for our hands-on career-focused programs, we saw a slightly larger decline in enrollment. As you can imagine, folks who came to UAA to learn a trade, such as welding or how to be a chef, are less interested in learning that occurs via technology such as the one that we're using here today. And so we are still in the process of figuring out how we can safely continue to deliver hands-on training. A lot of that will look very different for the fall, but there will be, at this time, we believe, smaller numbers of students will be allowed on campus with social distancing, sanitation, and other measures to keep everyone safe so that they can learn the hands-on skills that they know will help them get employment. One of the things that the university is doing to respond is its new scholarship program. You may have seen the advertisements for the 49th Finishers program. UAA is providing, this is brand new, up to $8,000 in funding over multiple years for individuals who may have started a degree at some time in the past and then stopped for whatever reason, perhaps because they were able to get a job and now maybe they've lost that job. And so we're really encouraging folks to check out that program and come back. That applies primarily to a 4-year degree. The second thing that UAA is just launching and I think is really relevant to the discussion today is we are working on a series of very short-term certificate type training programs that are, as best as we can figure out, research-based to meet the needs of industries that still have employment opportunities for Alaskans. We're talking here about very short-term education. Some of them will be as short as a single 4-month-long semester. Others will be about a year long, but most of them will be less than a year for a student to finish. And I can give you a couple of examples. We've got one, for example, that's geared toward IT support positions, because we've seen still a number of ads on Indeed and elsewhere for those kinds of positions. As more and more people are working and operating remotely, their IT needs have gone up. We've got several that are health oriented. We're offering the phlebotomy certifications. There's a new, very short-term program to train contact tracers. Clearly, there's a big need for that in Alaska. And so all of these programs will be finalized and announced over the summer. But I'm giving you sort of a preview that the university recognizes that we have the ability to provide training, and that many people who have lost their positions in these last 3 or 4 months might be looking for a way to get retrained quickly. And we stand ready to help with that. The other thing I wanted to mention is that UAA's colleges, all of the colleges at UAA, do very much work with local industry and try to make sure that the programs that we're offering really train the workforce that Alaskan industries need. And so, that is obviously shifting, and we intend to be as much as we possibly can in all of the conversations so that we can adapt our programs as the workforce needs continue to change, and as the skill sets that people need continue to change. So this summer we have faculty working in teams to create a couple of new, not really new courses, but courses with a different focus to get people to think about, for example, communication when you're a remote worker, or writing skills or technology skills when you're working remotely. And we're hoping that all of that is of value and is useful to the employers in our region, and that can help in the efforts to get the economy going again.
Great, thank you so much, Dean Runge. And I know that you're gonna have to leave soon, so if we have any questions specifically for you, I'll make sure that we get that sent to you via email.
That would be great. Thank you so much.
Thank you. So next we have Joelle Hall, Director of Operations at the AFL-CIO.
Well, good afternoon, everyone. My name is Joelle Hall. Greetings to the Assembly members and Chair Rivera. Thank you so much for asking us to be a part of this today. Following my comments, we'll be joined by some other folks who do direct work through our apprenticeship programs in the state of Alaska. But first, I wanted to talk a little bit. The AFL-CIO is the umbrella organization of Alaska's unionized employees. We represent about 50% of our federation or building trades and generally construction-oriented work. And the balance is a mixture of private unions and public sector unions. It's really important to note that the majority of our folks who are in the AFL today are what we would consider a frontline worker. They are a state employee working on the front lines. They are nurses. They are grocery store workers and hotel workers, as well as the people who work for you in the municipality of Anchorage, who are providing the vital services to keep this municipality working forward. And so we're going to talk a little bit today about workforce development on the apprenticeship side, and we have a whole other side of these workers who need to be retrained and trained to work in the environments that they find themselves working in today. I want to put a plug in for you as a governing body. Money coming through the CARES Act and through the Eventual Heroes Act is designed to keep local governments whole and healthy and to keep your folks employed. And we would implore you to apply as much of that as possible to your existing workforce to make sure they're there to meet the needs in a safe way of the communities that which they serve. I want to bring to your attention, I think you've been given a handout from Chair Rivera about a program called Alaska Works. And we're going to talk a little about this today because this is one of the training modalities that maybe you're less familiar with. And both Bronson and Deb, who will follow, can speak really well to how Alaska Works functions. But Alaska Works is basically an intake system that's a nonprofit that is a partner with the labor movement, as well as any other employer in Alaska, union or non-union. And they administer programs like Women in Construction, Helmets to Hard Hats, and the construction academies. And so this is a commonly used system for people who are traditionally they're not making their way into the apprenticeship directly out of high school. Maybe they've had a job, they're retraining and they're looking for a new skill. They're looking to try to get into the apprenticeship after a different career. Maybe they need some brush up on some basic skills that they need in order to be able to enter the apprenticeship, which comes to mind frequently are math skills to enter some of our apprenticeship programs. This Alaska Works is situated to take funding through grant funding to build training programs that can be deployed inside the municipality of Anchorage. And in fact, they can be deployed anywhere inside the state of Alaska to build both modules and training programs to meet the needs of the workforce as it moves, as Bill Pop suggests. But also in this current environment, if there was a requirement, for example, for OSHA qualifications or OSHA training or different types of safety training for different workplaces, Alaska Works is working on right now setting up some training modules so that those skills and those trainings can be available to the people of the municipality of Anchorage. So I want to make sure that if you're not aware of Alaska Works, that you read the flyer and we can get you their contact information, and they'd be more than happy to come and present at a separate time. I'm sorry that it didn't work out today. I think many people on the phone are roughly familiar with the apprenticeship system. Apprenticeship, in particular union apprenticeship, but I want to be cognizant, there are non-union apprentices, of course, in America. Union apprenticeship is the second largest training system, non-collegiate training system in the country behind the U.S. military. The U.S. military and the union apprenticeship system generates the most trained workers that don't come out of a university model. We are created, funded, and staffed entirely from within. We can take grant money, but by and large, this training system is paid for by the previous students who graduated from the apprenticeship system and the employers who benefit from that apprenticeship system. So it is a system that intakes as many workers as are needed to build the work of the future. So the only stopgap to putting lots and lots of people through the apprenticeship is work for them to do. It's a blend of hours in the classroom and hours on the job site. And with that, I think most of you are pretty familiar with the AFL-CIO. We're going to start off with Deb Kelly, I believe. So thank you very much for asking us to be here today, and we look forward to any questions as a follow-up.
Great, thank you so much, Joelle. So we'll turn it over to Deb, who is the statewide director of the IBEW apprenticeship program.
All right, hello, can you hear me?
Yes.
All right.
Yes, we can hear you.
So my name is Deborah Kelly. I'm the statewide training director for the IBEW NECA apprenticeship program here in Alaska. And I'm here to talk a little bit about what Joelle covered, more specific to our program. Like Joelle pointed out, we are mostly internally funded by the people who went through our program, became journeymen, and then work out in the field. And they and their employers contribute based on an hourly basis to our program. We turn it back around and invest it back in the community into training programs. And one of the beautiful things about our program, we have over 50 partner employers who employ our apprentices. Many of those are contractors, and many of those contractors are actually they're businesses that were created and are run by people who went through our apprenticeship program. So our program doesn't just build the workforce itself, but it actually builds the businesses too as we go through the future. And as COVID-19 has affected so many sectors here in Alaska, many of our apprentices and our employers have continued to work because we serve both the electrical and telecommunications industries, and the lights have to stay on, and telecommunications reliability is more important than ever right now, as evidenced by this meeting that we're holding, and we're all in different places. We serve ML&P, we serve Chugach Electric, and Alaska Communications are three great local examples right here in Anchorage of places that get their frontline workforce from our program. So we're able to do our core functions in-house, but we do get some grant funding that makes a huge difference for us. We have external funding that helped us put on our Veterans Electrical Entry Program, where we are able to bring in transitioning military service members and provide them with initial training and secure them with a career anywhere in the country. So as they get out of the military, they know where they are going to live and what their career is going to be when they get out. And through some Alaska STEP grant funding, we're also able to increase not only our apprentices' employability in the trades, but we're also able to expand the trade into future and emerging technologies. So one great example is our recent deployment of a drone pilot training program. So we're now providing our apprentices with FAA 107 drone licenses so they can go out and do right-of-way inspections using drones instead of the old way of helicopters and expensive, dangerous operations by helicopter. Now we're using drones, and our people are able to capture that sector in-house. I can't say enough about Alaska Works partnership. Our partnership with them has enabled us to reach further out from just the construction industry and into underserved populations that may not have had the knowledge or opportunities to come into our apprenticeships before. I mean, Alaska Works, and as Joelle pointed out, they're mostly grant funded. They do outreach, they do case management, and using our instructors, they provide pre-apprenticeship classes that help prepare people for the electrical and telecommunications trades. Many other trades too, but I have firsthand knowledge of the amount of people we bring in through Alaska Works pre-apprenticeship programs. And I can't say enough about how that makes a difference, especially as we're looking at these impacts of COVID-19, where it's hitting the service industries and the tourism industries really hard. In the past, a lot of our applicants might have needed to go out and get some relevant experience, right? So in the past, we'd bring in a lot of people with construction experience. Well, through Alaska Works pre-apprenticeship programs, they can prepare people from service industries, from tourism, from anywhere. They can give them that initial awareness and skills training to be ready for one of our apprenticeships without having already been in the industry sector that we're training for. And they also help us out by providing some OSHA 10 and CPR first aid classes, standard things required on most construction sites. And Alaska Works is also working on a COVID-19 workplace training program right now. I think they're most of the way done with it. I'm not going to speak for them, but we're looking forward to using that to help our workforce stay safe on the job site with so much new knowledge that everybody has to learn just to be able to go to work. You know, COVID-19 is hitting our industry, but it's not hitting us as hard as many other industries out there. We supply, as I said before, over 50 employers with apprentices, and most of them are still out there working every day. We've had to rapidly pivot to distance learning where possible. We've had to delay and redesign some of our hands-on training to keep our training pipeline intact, but we've had no choice but to continue to maintain and grow our program because the critical infrastructure that our workers are supporting is still there, and it still needs to be maintained and built. That kind of concludes my comments. I'm happy to take any questions or comments you might have.
Great, thank you so much. And yeah, if assembly members have comments, please put yourself in the queue. We will take questions after we're done with this presentation. So next, I think we have Bronson Fry, who's the business representative for the International Union of Painters and Allied Trades.
Hey, good afternoon, friends. Can you hear me all right? Good. So my name is Bronson. I appreciate the opportunity to be here. As Chairman Rivera pointed out. I am the business representative of the Painters and Allied Trades Union, and I also serve as an officer of the South Central Alaska Building Trades Council. The Building Trades is a group that consists of all of the different construction unions. So you're going to have your pipe fitters, electricians, laborers, painters, and so on. On behalf of both my own local union and also the Building Trades Council, I appreciate an opportunity to join you and explain a little bit about the apprenticeship model. I think Joelle and Deborah did a great job on that. I want to say for sure that the best thing in order to put people to work through any program that has this type of on-the-job training, what we really need is money on the street for construction. And I think the Anchorage Assembly is uniquely suited to help us with that. And I definitely wouldn't want to see that go understated today. There are a federal set of guidelines that all apprenticeships have to follow, and there are standards that have to be met in order to be a federally registered apprenticeship program. Some states are controlled by the state. Alaska is controlled by the federal government. So there are some processes and rules that are a little bit different in each of the trades, but what is the same is that we need the work opportunities. And the reason that you would maybe look to construction as a great place to invest in the training and opportunities, there's several reasons for that. I think that Bill Pop touched on it when he came and touched on the fact that there's going to be retraining required for some folks. There is going to be a shift in the type of jobs that are required as we go through this pandemic and come out on the other side of it. That is potentially even within the world of construction. One of the advantages of the apprenticeship model is that we address health and COVID-19 concerns by keeping our apprentices and other members on the cutting edge of what the industry standards are for safety. Speaking of industry standards, I'll just wrap up by circling back around to the Alaska Works partnership. I do serve as a board member at Alaska Works. I should mention that in full disclosure. I wanted to highlight the Helmets to Hard Hats program that the Alaska Works partnership spearheads here in Alaska. That provides for direct indentureship of military veterans into these apprenticeship programs, essentially bypassing many of the steps that would normally be there for someone to join an apprenticeship. So having anyone in our community that's got that veteran status, they can slide right into these programs. There's also specific outreach for women in construction, as well as training in rural Alaska. The highlight, one of the highlights of what Alaska Works does is puts on basic construction training classes, the Construction Academy, it's called, where folks can go in for 40 to 60 hours, learn some basic skills in a particular trade, and then find out if perhaps that would be a career they'd like to pursue. And then Alaska Works can help them find the appropriate apprenticeship program. So we have a changing technology, some of it in the construction industry, like Deborah mentioned. We do have an aging workforce in construction. That's something that across the nation we're sort of dealing with. Our state is having some financially difficult times here. So I think that the Assembly, like I said at the outset, is uniquely suited to help out here in a few different ways. I'd be happy to take questions as well if there are any.
Great, thank you so much. Yeah, Jennifer, we can go ahead and take that document down. That for Assembly members, I think you were emailed that document, and for members of the public, that is on our work sessions page. Okay, so at this time, we can go ahead and take any questions from Assembly members on this panel. Start with Mr. Constant.
Thank you. Hello, everybody. I have a challenge for you, and that is to go back home and talk to your networks across the country and investigate if there are any retraining programs that your peers have found that are successful in addressing helping individuals who experience homelessness move back onto their own 2 feet. I would love some analysis from your networks of people, because we always hear from the social service networks and we never seem to get past need housing and need shelter. And I know that employment is one of the key assets that people need, a meaningful way to use their life to contribute to society. And so I would like you, if you don't mind, to go back and tickle your networks and see if anything falls out of the tree.
Yes, sir.
And Christopher, the other thing I wanted to mention is I do know that we have, there is lots and lots of programs around the country, primarily organized through the iron workers that are working with people who are leaving incarceration. So it wouldn't surprise me at all if this was a model that had been worked out in some of the other larger jurisdictions like King County, particularly those larger places. They tend to have these kind of programs set up and run through either a workers center or through a building trades local or a central labor council. So got it, will do.
This could be a high investment area because it meets a lot of Venn diagram circles.
Great, thank you, Bronson, Joel, and Mr. Constant. Any other questions? Okay, I'm not seeing any right now. Really want to thank Denise, Joel, Deborah, and Bronson for providing this important perspective, and looking forward to continuing working with you in the future. So with that, that is the end of our lengthy panels today. Really want to thank everyone for participating and highlighting a lot of the community impacts that we are seeing in various populations and groups within the municipality of Anchorage. Truly do appreciate it. For my colleagues, you should be expecting an email from me through Barbara or Jennifer in the coming hours, talking about some of the next steps that I'm hoping we move forward with. As I previewed at the beginning of this meeting, this is the last of 4 roundtables that we've had. And so now it's time for us to continue our investigations and get to work on some of these very specific issues that we have explored. Continuing that work with everyone. Thanks, and I hope you get to enjoy the wonderful weather we are having.